Howdy do. Alright, for context, I am playing this old PC game called Pet Pals Animal Doctor that I picked up at a garage sale. And I'm so happy that it works on my computer, because I would love to play more old PC games. Alright, let's start this. Legacy Games. It's the loud as heck intro. People walking their pets off leash. This is a nightmare. The dog barking at the cat being carried. I love this dude cuddling his iguana in the park, on the park bench. Alright, there you go, now you can see my cursor. Alright, new game. Our name is Doctor Who, apparently. We're gonna play on hard mode, because I'm not a little baby. Let me turn this up, so you can hear the game better. And we can change the skin, treatment skin. Robin egg is blue, iguana skin is green and yellowish. Aquarium, that is very busy. Parrot paradise. Furry friend and ecosystem. Let's go with robin egg for now. We can probably switch them up between cases.
Hello, I'm Sharon Rothman, and welcome aboard. You'll have plenty of opportunities to take care of all sorts of animals here. Since this is your first day, I thought I'd introduce you to some of the veterinary technicians you'll be working with.
Dude.
I'm Tess. I'm so excited to be on your team.
I heard good things about you, so you'll be happy to know we're the best in town.
God.
Well, we're the only in town, but that's not the point. I'm Javier, but you can call me Javi.
And I'm Antonia. I'm looking forward to having someone like you in charge, so let's get to it.
Just remember, we're all here to help and to let you know how you're doing. Feel free to settle in. We can't wait to start working with you.
Am I a vet? Am I actually a vet? I forgot the first text name. And the doctors, and whoever that doctor is. Okay. Let me move this. Move this over here. Okay. Okay. What's this? Link binder. Voicemails. Computer. Trivia. Okay. Gerbils like to keep clean. What should you put in your gerbil's cage for it to bathe with? Water, hay, soap, or sand? Probably sand. If gerbils have a small container of sand in their cage, they will roll around in it to clean themselves. All snakes are herbivores, carnivores, omnivores. Snakes may be any one of these. All snakes are carnivores. They eat rodents and other mammals, birds, reptiles, fish, amphibians, insects, and eggs. How many trivia questions are there? True or false? Rice is rarely thrown at weddings now because when birds eat it, the rice swells up in their stomachs and makes them explode. What? I thought it was because people get deaf when the rice goes into their ears. That can cause hearing damage. But since this is a game about animals. Let's say true. Rice is no longer thrown at weddings because it makes the ground slippery and causes guests to trip and fall. Rice does not cause birds to explode. How long ago were cats first domesticated? Not that long ago. Just kidding, 4,000 years ago. The punishment for killing a cat back then was death. Which of the following animals is not a reptile? Tyrannosaurus rex. The newt is not a reptile, but an amphibian. I'm getting a C on this quiz. Alright. Enough of that. I'm hired, and the first thing I do is answer trivia questions on the computer. Memory. Whoa, Jesus Christ. No, I don't. No, hold on. That's a lot of tiles to be remembering. Guide. Holy cow, I can't read that. Oh, this is all tutorial. Okay. Tools. Glossary. My god. Wow, that's actually a lot. Animals. Oh, a jigsaw puzzle. What is this flash game looking thing? Give me a hard one. Just kidding. I should have went easy. Grid on. Oh, that's spoilers. I like the sound. Solve. There we go. I solved it. Easy peasy. Alright, anyways, let's move on to what do we do here? What is this? Care for Parsons Terrier, care for Labrador, Saint Bernard, and Beagle. Ooh, use a sponge to apply soap to the animal. Keep going until the meter is completely filled. What does it say? Be sure to cover him in bubbles. Oh my god. Not the square bubbles. Now it's time to use the brush to wipe away the bubbles. When the meter is completely filled, you've done your job. What is this, dry shampoo? This is like a Nintendo DS game. Is it done? Congratulations, you finished grooming your animal. Okay. Oh, I got 200 out of 200 points for that. Okay. Anyways, what's this? I just get to look at this picture. That's nice. This reminds me of Nancy Drew. Even down to the colors, like this turquoise blue. Oops. Wait, I just left without saving. It's okay, we didn't do much. Alright, let's... Scruffy. Male neuter, 2 years old boxer. Wound on right front paw. Let's treat that. We kept him waiting long enough. We even left the building.
I thought I'd give you a few pointers so you'd know how things work around here. First things first. Listen to what the owner and vet techs say about the animal's condition.
I lost my Scruffy last week when I took him to the park. Oh, I was afraid I would never see him again. But today, as I was about to leave for work, I found Scruffy laying on my porch. I called his name and he looked happy to see me, but he wouldn't walk up to me. I'm afraid my Scruffy is hurt.
Dude,
His front right paw looks raw. But don't worry, our doctor will take good care of him.
Yeah.
The next thing you'll want to do is ask the owner questions about the animal. To see a list of questions, click the talk button.
The talk button? Q&A? Normal vital signs. 10 to 30 resp. 70 to 160 BPM. Temp. 58 pounds.
Try clicking the button with the speech bubbles on it. Try clicking the button with the speech
Hold
bubbles on it.
man.
Try clicking the button with the speech bubbles on it. Once the questions appear, select only the ones that would be appropriate for the case.
What's
Try selecting the
Scruffy's
second question.
favorite color? Do you think dogs are really man's best friend? What can you tell me about Scruffy's injury? Does Scruffy like chicken or steak better? How fast can your dog run? What's Scruffy's favorite color?
Click the second question in the list.
Oh, okay. What can you tell me about
I
Scruffy's
noticed
injury?
his front right paw looked wounded, so I brought him here. Figured you'd know what to do. I got him some water and he seemed really thirsty.
Okay. And now what's his favorite color?
After you find out about what's going on with the animal, you'll want to perform a physical examination. All the medical equipment you need is available in the groups at the bottom of the screen. You'll probably want to start with the examine, monitor, and test groups first. To select
Jeez.
a group, click on their icon. Remember though, if the situation is critical, start your treatment right away. You can go back to do a full examination once the emergency is under control. In this case, let's first use the magnifying glass from the examine group. Use your mouse to point to the magnifying glass and click once to pick it up. In the examine group, go to the magnifying glass, which is the first tool on the
Okay.
left, and
They
click
got a
on it
lot of
once.
tools here.
Did you notice that rolling over a medical instrument will
Lord.
make its name appear? Its description also appears over on the right. Now let's take a closer look at this patient's foot. Click on the front right paw section of the animal. Click the button in the lower right corner of the screen. Click the button in the lower right
What?
corner of the screen.
What are you talking about? Use the stethoscope to check its
Click
breathing.
the button
Okay.
in the lower right corner of the screen. Well, let's try to listen to this patient's breathing. Click on the stethoscope to select it. Now select the chest of the animal. Point to the chest area and click.
Normal.
After performing the physical exam, you should have a pretty good idea about the patient's condition. You can then move on to the treatment phase, where you'll use the maintain, operate, and medicate groups.
Oh my god. Maintain, operate, and medicate, hair clipper, scraper, extractor, sponge, compress, cold compress, dental speculum, used on horses to lock the mouth open. That's scary. Gauze. Give the
Click
sponge
the
and use
button
it.
in the lower right corner of the screen. In the maintain group, select the sponge to clean the area. Good. Now select the topical medication in the medicate group.
Medicine syringe, topical med, oral, IV med, IV fluid, IV blood, oxygen mask.
Point to the wound on his right
Oh
paw
god.
and click the mouse on the affected area. Nice work. Now select the bandage in the operate group. Point to the bandage at the bottom of the screen and click.
Synthesis needle? Ew. Orogastric tube. Urinary catheter.
Point to the wound on his right paw and click the mouse to apply the bandage. Excellent job.
I don't know about
Click
that
the
bandaging
button to return
job.
to the previous view of the animal. Click the button with the check mark near the bottom center of the screen.
Check out.
What appears is a list of possible diagnoses for your case. Based on what you've done, you should be able to tell which is correct. Your score will reach the maximum 1,000 points if you choose the correct diagnosis.
I think he's got
Select the third one in the list
mad cow
and
disease.
click the check button. I'll be here after each case to go over what you've done. Get a perfect score, and I'll have something special for you. And at the end of the game, if you've treated all of your patients perfectly, I'll have a big surprise for you.
Okay, now we gotta.
I'm sure you're ready to dive right in. Get to it.
We gotta 100% this thing. Like the little fish. Oh my god, there's so many of y'all. Jojo, female intact 12 weeks, Yorkshire Terrier puppy. Time for her first general checkup. Difficulty breathing? That sounds like a more emergency than a checkup. Walks in circles and seems dizzy. Repeated vomiting with blood. That sounds bad. Not eating and diarrhea. Oh, it's a little rat! Swelling on rear leg. Don Quixote. We should probably just check this difficulty breathing cat. Just kidding. Let's go to your first here. Jojo.
What a beautiful puppy!
Isn't she? She's my first puppy. I decided to take the plunge.
Good for you.
This is her first checkup, so I'm a little nervous.
It's fabulous that you're bringing her in. I hope to give you nothing but good news, but that's up to you-know-who. Ready, Doctor?
Oh, that's up to you know
I
who.
haven't had a puppy since I was a little girl.
What? I love their voice acting. What a beautiful puppy. Okay. Height 12 inches, 3 pounds. Time for her first general checkup. Can I pet you? Your little tail. Alright, let's look at you.
Normal for a newborn puppy.
It's not newborn. It's been here for 12 weeks. Oh, God. Use the glove to feel the animal.
This is going great.
Palpation gloves, front right leg. As each segment is pressed upon, no pain is elicited. Normal muscles are felt. No deformities present. Check the pulse. I only checked the front right leg. Using the gloves on the hind leg. And pet your butt.
I'm glad you're taking care of Jojo.
Pulse at the inner thigh is strong and regular. Strong pulses generally indicate that the heart is pumping normally. Try using the stethoscope on the animal's chest. Oh god. 20 BPM is normal.
Jojo has been chewing up my shoes. Is there anything you can do about that?
Music to my ears.
I mean music to your ears. Check the animal's temperature by using the thermometer on the rear. Oh, you'll love that. For birds, it is applied to the cloaca. That is unfortunate. 101 to 5 is normal.
All normal.
Examine the ear using the otoscope. God, you look crazy.
This puppy is pretty
Ew.
clean, too.
Look, that's disgusting. Test for parasites. Use the fecal test on the animal's rear. Stool test, blood test, bacterial test. Fungal, urine, clotting test, water test. Oh, for fish. Test for internal parasites and diarrhea. The stool sample can be collected directly from the rear or from stool on the ground. What the? Alright, poop for me. Oh god.
Oh, no! And I thought we were home free.
Test is positive for roundworms. Roundworms are a common internal parasite of puppies. This puppy needs to be vaccinated. There's no roundworm vaccine. Use the medicine syringe on the animal's front leg.
Jojo was really excited to come here. I hope she's just as excited next time.
Her voice. And front leg delivers medicine. Okay.
Jojo may not like it, but it's the only way.
The puppy receives her first DHLPP vaccine. Puppies require a series of vaccines until age 16 weeks before they are considered protected. The owner will receive a puppy care kit. We're not going to treat the roundworm? Sign out. What's your diagnosis, doctor? Roundworm.
Did I do something wrong?
No, you brought her in, and we caught the problem. If all pet owners were like you, our jobs would be a lot easier. Keep it up.
Thanks. I'll try my best.
Jojo will thank you for it.
Good thing Kimmy brought Jojo in when she did. Puppies need to follow a regular schedule of vaccines, and Jojo certainly needed her roundworm vaccination. Without treatment, roundworms can be fatal. With your intervention and the owner's help, however, Jojo should suffer no long-term problems.
Wait, I only got 900 out of 1,000. What did I miss? Next.
Thank you for identifying the proper diagnosis. Dig a little deeper next time
Oh,
with more
I
questions.
forgot to ask questions.
Due to your treatment, this animal will recover in no time.
Well, time to restart. Just kidding. I need a 100% Pet Pals animal doctor. Alright, Tango is a Berman cat, 4 years, spayed, difficulty breathing.
Thank you for seeing us on such short notice.
Of course. We love to help people who love their pets.
You have to understand, Tango is very important to me. So today at the show,
Show?
the cat show, when she received her Best in Breed award, I noticed she seemed to have trouble breathing and I just don't know what I would do without her.
I know you're scared, but you don't have to be. The doctor will take care of her. You'll see.
Bro, don't put everything on
Please
me.
be careful.
26 to 30 BPM, 160 to 240, 100 to 102, 10 pounds, Tango, 4 years, difficulty breathing. All right, let's talk. Ask the 3 correct questions. You have 4 chances. How many trophies has your pet won? Have you noticed anything abnormal? Do you dress your pet in little costumes? Has Tango been acting? Have you noticed anything abnormal? Yeah, the difficulty
I
breathing.
couldn't even imagine it. Well, she did win Best in Breed, you know.
Okay. Have you found anything strange?
Oh, no, not that I am aware of.
Can I turn up your sound settings? Info? Oh. Glossary? Okay. I think about acting strangely.
She keeps coughing.
Okay. Let's look at you, Tango.
Her nostrils are still flaring. Wow, her gums have turned blue.
Oh god, that's bad. Bluish gums seen. Windpipe pressure produces cough. Bluish color is a sign of poor tissue oxygenation. The cough indicates respiratory disease. Check the abdomen. Nope.
Oh, you can hear her wheezing.
Oh, I hope Tango will be able to enjoy her prized ribbons.
The abdominal muscles are working hard. Wheezing sounds heard when she inhales. Respiratory rate is 80 breaths per minute. Wheezes are classical sounds in asthma. The respiratory rate is elevated. Check the pulse. Use the oxygen mask on the patient's mouth. Alright, let me check the pulse.
She's very special to me, and not just because she's a purebred.
Here, get your oxygen.
I can't wait to see our friend all better. Let's get going. Tango isn't the only one breathing a little easier.
Patient appears less anxious. Respiratory disease distress requires that oxygen be given. Examine the head and mouth. Oh my god, what do you want me to do? Hold on, let me take your temperature while you're hooked up to oxygen. Tail. Rear. Where's your butt? Where's your butthole? Rear. 101 is normal.
You work as gracefully as my cat moves. Huh?
Okay, this is normal result. X-ray the lungs. Did you want me to look at the whatever? Examine the insides of the animal's body. The image shows the internal structure of the animal, such as bones and organs.
That
Oh.
inflammation must be the problem.
Oh, I hope she'll be well enough for the next cat show.
Hyperinflation of the lungs and an airway pattern seen. The diaphragm is flattened and there's a large amount of air in the stomach. These findings are clear signs of asthma. Use a pulse oximeter on the animal's ears. I wonder if this is a real x-ray. Whose cat is this? Pulse oximeter measures the amount of oxygen in the red blood cells. The higher the number is, the better. This tool is applied to the ear.
I might recommend you to the other cat owners on the cat show circuit.
Pulse ox is 86%. Severe hypoxemia seen. Not enough oxygen to the bloodstream. Administer medicine. IV meds. Take that. Stab.
She's better already.
A fast-acting corticosteroid and small dose of epinephrine given. This patient's comfort is dramatically improved. The owner needs to be informed about future flare-ups. Is this game for children? Do children know how to pronounce corticosteroid and epinephrine? Look at the IV bag. What's your diagnosis, doctor? Rabies.
Oh, I am thrilled my Tango will still be able to show her talent. I hope she never has to go through that again.
She may have to. Asthma doesn't really go away, but I can tell with you by her side, she'll be dancing in no time.
When the lung airways constrict, asthma may be the cause. Excess mucus forms, airways swell with inflammation, all leading to breathing difficulty, and sometimes worse. Once this cat's owner learns how to recognize the signs, she can take early action to prevent a life-threatening crisis. You reached the right conclusion. You understand the importance of There's room for improvement, but your treatment of this animal was
Sorry, I
great.
clicked on the nose instead of the mouth. My bad. Alright. Third time's the charm. Alright, happy 14 years old German Shepherd. I think you're, I diagnosed you with old age.
What seems to be the problem, sir?
He's not feeling well.
His head seems to be leaning to the left. Can you give me a little more? Is he acting strangely? Is he not eating?
Yes, All those things.
Okay, since we're not getting a lot from you, I'm gonna turn this over to the doctor. Good luck.
Since they're not getting a lot from you.
wants dog healthy.
Oh god. A dog with severe facial swelling has arrived and needs you immediately. Click on the emergency icon to go to help her. Don't delay or you lose points. I'll be returning to this case when you're done. Dude, if I was this dude, I'd be like, what the? Alright, where's the emergency icon? This one? Am I the only doctor here?
I like to hold China close and cuddle her, but now I can't. Can you tell me what happened?
Yeah, that's
Oh.
usually where you come in. As far as I can tell, it looks like she decided to take on the 3rd Battalion solo.
What?
Who the 3rd Battalion is, I couldn't tell you.
So you don't know what to do?
Of course we do. Well, the doctor does at any rate, and that swelling isn't going to go away by itself.
Oh my god.
Doctor?
He
China likes
said,
to walk and play. Maybe that is the problem.
he said, that's where you come in. You're supposed to tell me what's wrong. Okay. China, 4 years old, female spayed. Face is badly swollen. Looks like a freaking a bite, bro.
2 small puncture wounds. Well, it's either a vampire or a rattlesnake.
Skin is moist and red. Venomous snake bite. Oh, use the gloves on the hind leg to check the pulse. I got you, China. Don't worry.
She could be in shock, or maybe she's just afraid of me.
Elevated pulse rate can indicate anxiety, excitement, pain, or shock. Palpate the patient's abdomen. What's the regular pulse rate? 160. Let me touch your belly, not your posterior. Anterior.
A swollen belly. Well, I'm guessing it's not due to doggy nachos.
Bro, Javier, relax. Belly tender and palpation generate some attempts to vomit, no distension. Will likely require IV fluids and IV meds, but you should continue your investigation to be sure. Listen to the animal's chest. 20 beats, that's low. That is mad. Wait, no, that's the rest. That's normal. I thought they were talking about heart rate.
You treat her like she were your very own. You want to cuddle her too. I can tell.
Sure, sir. The breath sounds are normal. Exam findings are normal. Use a thermometer on the patient's rear to take the patient's temperature. Give me your butthole. 104, that is so high.
Yikes! Hopefully that temperature will go down. Oh, and I'll never say yikes again.
He's a little jokester. Cause of high temperature includes overheating, inflammation, infection, excitement, and seizures. Use a blood test syringe on the animal's hind leg. Draw a sample of the animal's blood for testing. Most samples are taken from the legs or rear legs, but from the tail for reptiles. Give me your blood.
Abnormal blood test, puncture wounds, adding up to...
Mild liver elevations present. Abnormal. This result suggests moderate poisoning from the snake bite. Clotting tests are indicated in all cases of snake bites. Clotting test. The blood proteins and platelet functions are then tested to see how well the blood clots. Turns into a liquid. Turns from a liquid into a semi-solid mass. Give me your blood.
I would leave you alone to work, but she would miss me too much. If she could thank you, she would.
Front left leg. PT 14 seconds. PTT 15 seconds. Buccal bleeding time. I don't know what this means. Results are normal. Snake venom contains anti-clotting factors, so it is especially important to obtain this information for all snake bite venoms. That's scary, actually. Can I see buccal? B for buccal? Bumblefoot. Okay. IV meds.
Drip started. I've got a handle on it, Doc.
Anti-venin. Drip started. Antibiotics administered. Anti-venin consists of antibodies against snake venom. It is given slowly by drip over approximately a half hour. Antibiotics are helpful to control infection. Administer IV fluids in the animal's front leg.
She's on her way.
IV fluids administered at a dehydration maintenance rate. Snake venom is a powerful dilator of blood vessels, which means that shock could occur at any time. This patient will need monitoring for at least the next 24 hours. If shock occurs, the fluid line will be already in place and ready. Why, are we sending you home like this? I forgot to ask the questions again. Do you dance with China? Have you seen anything different about her? Does China have any brothers or sisters? In what way has her behavior changed?
China likes to stay close to me. We were in the backyard and she ran off for no reason. Then she yelped and ran back to me. That's when the swelling began. I didn't want to cuddle her because it looked like it would hurt.
Have you seen anything different about her?
Yes, her poor swollen face.
What am I missing? Why do I only have 900 out of 1,000? Really wants me to sign out. You good? Are you good, China? Are you good? What did I miss? Whatever. What's your diagnosis, doctor? Rattlesnake bite.
Come here, little China. Did Daddy make it better?
Daddy, you did make it better by bringing her in.
Can I cuddle her now?
Oh my god.
You might want to wait to make sure she's fully recovered.
Just a little bit?
Oh, all right.
Apparently a rattlesnake was what lured China away from her owner, which may happen a lot. Although tissue damage can be severe at the bite, patients can recover with fluid support until the toxins are out of their systems. China's owner brought her in right away so that anti-venom will prove useful. If he had waited much longer, this case could have been a lot more serious.
Lucky.
That was a highly You really know the right questions to ask. You diagnosed this patient. You did a superb job in your
You want a perfect score trophy. Yay. That showed in a little Windows pop-up, by the way, so I don't think you saw that on stream. Alright, German Shepherd. What's your name again? Happy. 70 pounds. Sounds like an ear infection.
It looks like Happy can't hold his head up high.
He is good dog. He does not bark much.
Head tilt is a vestibular symptom. It indicates a problem with the vestibular system which controls balance. The head tilt is generally towards the side where the vestibular neurological system is damaged. Use a magnifying glass to look at the patient's eyes. Eyes are darting back and forth from left to right. The involuntary eye motions in this back and forth manner are called nystagmus. If it indicates a problem with the vestibular system which controls balance. Do a thorough review of vital signs.
Wish his owner had mentioned Happy was falling over a lot.
Oh, I forgot to question the owner. No pain or flexion or extension of the knees, no swelling. Patient seems unable to stand without assistance. The patient with vestibular disease will have difficulty walking and often difficulty standing. Check patient's pulse. Hold on, let me ask you your questions. Does your pet take vitamins? How does he feel when you've touched him? Has he been moving or acting oddly? Does your pet get enough sunlight every day? Did you notice anything different about him lately?
See yourself. He has tilted head.
Head. Does he feel... How does he feel when you've touched him?
He feels like a dog.
Has he been moving or acting oddly?
He walks in circles.
Okay. General muscle mass is reduced. Slightly elevated pulse. Elevated pulse rate can indicate anxiety, blah blah blah. We spread that. 20 beats, normal.
You treat my dog well.
Use the thermometer on your booty hole. 115 is normal.
Good.
Use a blood pressure gauge on the patient's front leg. Checks the pressure of the circulating blood against the walls of the blood vessels. This applies to the front right leg.
Good.
This is a normal result. Use 150. Use a blood test syringe on the animal's hind leg. Dude, we are moving all over.
My daughter wants dog healthy.
Your daughter what? Your daughter was what? Try taking an x-ray of the animal's head. Bite.
You make happy better.
Normal series seen. This most likely rules out a middle ear infection. Administer medication with a syringe. What's the medication though?
This isn't a cure, but it will help with any motion sickness.
Anti-nausea medication administered helps counteract the motion sickness that often occurs when the vestibular nerve is affected. I don't think we solved the problem. Sign out. Just lonely. Idiopathic vestibular disease, head trauma, anemia, neck fracture. You're old.
Great job, doctor. I'm sure Dimitri wants to thank you for taking care of Happy.
Goodbye.
Goodbye.
Well, at least Happy is happy.
No one knows the causes of old dog vestibular disease, but it can be upsetting to owners. Fortunately, this condition will improve with no treatment in a matter of days. The patient is usually back to normal within a couple of weeks, though sometimes a slight head tilt persists.
He did not want to thank me. He said goodbye.
Thank you for identifying the proper diagnosis. The questions you asked went straight to the point. You conducted your treatment quite well.
You want a perfect score trophy. Heck yeah. Alright, next. Hannah, female spayed 8-year-old beagle, repeated vomiting with blood. That sounds really bad too.
Oh my goodness!
Oh.
What's happening?
That's up to you. She's been vomiting pretty much nonstop.
Did you feed her anything? Did she get into anything?
Not that I can think of. Hannah's normally in such good shape. We took her to the beach yesterday, and she was running around, took my towel with her, of course.
She's
I
dead.
feel so bad for her. You'd think I'd be used to this by now. Hopefully the doctor can take care of whatever's bothering her.
Don't look at me like that.
Tough day at the office, eh?
This mom is so calm. Oops. Okay. Wait, I have to ask the questions. Does Hannah always have your towel with her? Does she like long walks on the beach with you? Have you felt anything out of the ordinary when you pet her? Has she been acting abnormally? And have you seen anything change about her lately?
No. Should I have?
Has Hannah been acting abnormally?
I wish it was abnormal. Well, okay. She doesn't normally vomit a lot. Now I think there's some blood in it, too.
Have you felt anything out of the ordinary when you pet her?
Not a thing.
Let's take a look.
So how many dogs do you treat in a day? I bet lots.
Eye membrane's pale, abnormal, indicates a dangerous loss of red blood cells. Use the magnifying glass to get a closer look at the animal.
Keep it up, doctor. And I may just have to be impressed.
What?
I don't envy your job, but then again, I doubt you envy mine.
Pale gums, abnormal, indicates a dangerous loss of red blood cells. Check the pulse. I doubt you envy
Oh,
mine.
poor thing is anxious. I love my job, but it would be better if animals never got sick. It's so sad.
Holy moly. Feel the mouth using the glove.
Pale gums, just like the eyes.
Gums feel sticky. Exam findings vary between normal and abnormal. The capillary refill test involves pressing on the gums until they turn white and timing how long it takes for color to return. If it takes more than 2 or more seconds, it is a sign of shock. Sticky gums are a sign of dehydration. This may indicate a need for fluids. Listen to the animal's chest using the stethoscope. Boop. That is normal, 20 beats per minute.
Do you do everything this well?
Use the thermometer on your booty. Booty hole. Rear. Oh my god, that's a butthole. 115 is normal.
I don't envy your job, but then again, I doubt you envy mine.
Give me your blood.
That can't be good. We have to do something right away.
Mini in-house blood test administered. PCV 20% low. Total protein 10.5 normal. Azo stick 30 to 40 moderately high. Glucose 125 normal. Whatever all those means. Results vary from normal to abnormal. Packed cell volume PCV is a reflection of red blood cell content of the blood. The normal
You'll
range
be okay,
is
sweetie.
38 to
This nice doctor
57.
will take good care of you.
Values under the normal range indicates anemia/red blood cell loss. The azostick value is an approximation of kidney function. A value of 30 to 40 is consistent with either kidney failure or dehydration. That's not good. Alright, IV fluid time. Boink.
A little of this means a lot less discomfort for Hannah.
Fluid therapy is necessary to stabilize the patient. Inform the owner about aspirin toxicity. Do I need to inform you? Administer IV meds. Take that.
You're doing a better job than Hannah does on my slippers.
Chlorpromazine and famotidine administered. The chlorpromazine helps to settle the stomach, and the famotidine acts as an antacid, which are helpful for aspirin toxicity. Sign out. Stomach worms, lead poisoning, bladder stone, gastritis, aspirin toxicity. We're just guessing. We didn't even ask.
Whew, I was worried myself.
It's a relief you could do something about it. I'll never go to the beach again, that's for sure.
Never?
Okay, I'll go, but only because I know Hannah is safe and sound at home.
Aspirin has many great uses, but only for humans. Sometimes humans make the mistake of giving medicine to their pets, but it looks like Hannah maybe ate an aspirin she found on the beach. With aspirin in her system, Hannah could experience not only vomiting, but also internal bleeding and kidney damage. Hannah will need to be monitored just in case there are complications. Although one medication caused the problem, antacids and other appropriate medicines that you prescribe will be the cure.
The cure. Nice.
Great job! You followed procedure without a hitch.
Perfect score trophy again. That's what we're talking about. Renfield, 8 months old male rat, not eating and diarrhea.
We've got a rat in today whose name is...
Renfield. I know, very funny. Can we get this going?
It would be nice if we knew more. He could be fine, he could be ill, he could be wondering why you brought him here. No, actually, that's us.
Okay, he hasn't been eating and he has a little diarrhea problem. Does that help?
Well, it's a start. Let's see what the doctor has to say.
My God, Javier.
Renfield keeps me sane when I work too hard. Must be great to be a vet.
This dude. Normal vital signs for a rat. 30 to 100 beats per minute for rest. Pulse 150 to 300. And temp 100 to 104. You're 4 pounds. Are you? I think you're heavier than the little Yorkie puppy. I think she was 3 pounds. Renfield. Let's look at you, buddy. Nothing abnormal here. Let's look at your little feet. Okay, let's look at your little, your other feet. Okay, let's look at your back. Anything? Can I look at your booty hole? Rear. Is that your booty hole? Am I missing something?
Drooling can be cute, but not to anyone I know.
Excessive drooling. Because of overgrown teeth, this rat cannot eat food or swallow properly. Use the glove to feel the mouth. Mouth.
Aha! Of all the problems that could have caused this, a nasty virus, a very mean owner, it's the teeth.
Palpation of teeth externally identifies overgrown teeth. Overgrown teeth are causing this condition.
It must be hard treating a rat since they're a lot smaller than dogs and cats.
Why you say it like that? Cats. Okay. Give me your poop.
Well, that's lucky. No parasites.
Alright. but diarrhea abnormal. Due to decreased food intake, the healthy organisms that live in the colon on this patient are dying and being replaced by disease-causing bacteria that are causing diarrhea. This diarrhea is not from a parasite infection. Take an x-ray of the patient's head. Bam.
Molars are overgrown. No surprise to me, of course.
An x-ray of the teeth helps to identify any other changes that could explain the abnormal tooth growth. The patient needs to be hospitalized for dental treatment. Correcting the dental disorder allows the patient to resume eating normally. Use a medication syringe to administer medication in the front leg. What the heck? You need to be hospitalized for dental treatment? Your little feet.
Yeah, we won't want him awake for this.
Ketamine and Valium is administered to sedate the patient. The patient needs to be anesthetized in preparation for correcting abnormal dental wear en route to internal medicine. The sharp points on its teeth have to be smoothed off so that the animal can eat without cutting itself. Alright, get out of here. Oh, I forgot to ask questions. I always forget. Have you seen anything physically wrong with him?
I can tell he's lost weight, so that's why I brought him here. So let's get going. Must take a long time to learn to do your job.
Has Renfield been acting strangely?
Let's see. He's been drooling a lot, and he hasn't been keeping food in his mouth. Good enough?
Who's Renfield's favorite cartoon rodent? Does Renfield have low self-esteem? Have you felt any injuries on him?
Didn't touch him.
Didn't touch him. Alright, sign out. My diagnosis. Slobbers. Tielism due to... Or is that an L? That's a T. Tielism due to large teeth.
I definitely need to be more on top of taking care of Renfield. I've just been so busy.
Well, now you'll be extra busy, making sure he's eating enough, that he's gaining enough weight, that he's...
I get your message loud and clear. Thanks, Doc, for helping Renfield.
Thanks,
Nice
Doc.
job. Looks like you cleared up more than just one problem.
As you can see,
What?
not keeping up with a pet's dental care can have far-reaching consequences. Renfield was eating so little food, he started to lose weight and became susceptible to infection. Once those sharp points on his teeth are gone, he should be well on his way to eating up a storm. Thank you for identifying the... You didn't waste your time.
Forgot to change the settings.
Hi, Doc. It's Kimmy with Roundworm. Well, my dog had the roundworms. Jojo got the last of her vaccinations, just like you said I should. She's going to be a great dog and a healthy one, thanks to you. Hello, doctor? Is Janet calling? You diagnosed my Berman with asthma? Anyway, I've done everything I can to help Tango. Anything that might trigger an attack, I've taken out of her reach. Thank you, doctor, for sharing with me how to make her life better. She's more important to me than all the ribbons in the world.
Hello, doctor. It's Carlos. I've been taking good care of China since the rattlesnake bite. Thank you for making her well. I will make sure that she plays safe from now on. Hello, doctor. My dog tilted his head. He would not eat. Doctor wants me to tell you Happy eats well. He stands up straight. Happy is good. Daughter wants me to say thank you.
That's nice. Don Quixote swelling on rear leg.
What happened here?
Don Quixote was running after one of the ladies.
You have another iguana?
No, literally. One of my ladies was over.
Uh-huh.
One of your ladies.
Okay, my sister was visiting. She noticed there was this lump here.
Was that so hard to say? Hopefully, it
My
won't
God.
be as hard for you, doctor.
He called his sister one of his ladies. Come on. Oh my God, look at him on the table. 10 to 30 beats per minute, 20 to 60 beats per minute. Not relevant for treatment. Don Quixote. "12 beats per minute is normal."
Just an FYI. Sometimes he bites for no reason.
It's okay, he's knocked out, buddy. Lungs are clear, no problems heard. Use the pulse ox on the iguana's ear. Where's your ear?
It's hard to find a vet who can handle an iguana as well as you, Doc.
Pulse equals 45 beats per minute. 95% is normal. Use a magnifying glass to examine the wound on the hind leg. Oh god, ew.
This swelling fits with what Richard said. I'm surprised.
Swelling noted above the vent along the femoral pores. The swelling seen is abnormal and needs to be examined more closely. Use the glove to feel the mass on the hind leg.
That white substance feels hard.
A hard abscess is felt. Reptile abscesses are hard and firm and must be surgically removed to allow healing. Take blood from the tail.
We're on to the real problem.
Blood drawn from tail vein. Test results increased WBC with a heterophilia. HCT, calcium, phosphate, uric acid, albumin, and glucose are normal. Blood work is abnormal and indicates an infection. Disinfect the wound with the antiseptic wipe. Yeah, we're gonna cut out this thing, man.
Don't want any more infection getting in.
Area is clean for surgery. Use the scalpel on the wound. The owner's just gonna be here for this. Use the scalpel on the wound, click and drag the scalpel downward to make a vertical cut. Let's go.
Now we can get rid of that abscess.
Ew. The skin covering the mass is open. Perform a bacterial test by taking a sample of the wound.
I always like to go the extra mile.
Abscess cultured. Results show Serratia sensitive to Bactral. Bacteria called Serratia is found. Remove the mass with the forceps.
Don Quixote won't miss this.
Ew. Abscess extracted. Removing the abscess will help the area heal and prevent further problems. Close the incision area by using the suture. Looks like a worm.
Well, there's always next time.
It is inappropriate to suture there? What do you mean? There's always next time.
I had a dog once, but reptiles are where it's at.
Perhaps there was a better way to go about that. I don't know what to say. He'll heal much faster now.
The heck? Skin suture closed. The area is closed to prevent infection and help the skin edges heal quickly. Use a medicine syringe to deliver medicine via the hind legs.
Mistakes happen. Next time you'll know what not to do. You certainly started out of the gate with a bang.
Did I kill him?
Because you've been treating your animals so well, you've already earned yourself an award. Keep up the good work.
Did I kill Don Quixote? By suturing his leg wrong? Hold on.
Hi, doctor. It's Maria. Remember how my dog ate some aspirin at the beach? Well, the weather's great, here at home, that is. Just in case, I made sure all our medications were far out of Hannah's reach. Now the only towel she's dragging around is the one in my bathroom.
Okay. Employee of the month. Doctor Who. Matey. Male intact 8 weeks. Very weak and having seizures. I can't believe I killed Don Quixote.
Please help Matey.
Whoa, I don't know who's more agitated, the puppy or his owner.
He hasn't been eating when it's time, and he's been collapsing left and right.
How is your other puppy?
Oh, you remembered. Jojo has been doing well, so I thought I'd get her Matey as a friend, and I don't know what's wrong.
Oh my god.
That's what the doctor's for. Don't worry, Matey's in good hands.
My god.
Puppies are the cutest.
Why would you get another dog, ma'am?
I don't know when I've seen this many fleas.
Ew, many fleas seen along lots of flea dirt in the coat. That's disgusting.
Probably seems high to you.
I forgot to ask questions again. Has he been acting strangely?
I haven't had him long, but today he fell and was just shaking all over. That can't be normal.
Has anything about him looked different lately?
I don't know, but I did just pick him up at a pet store.
Have you felt anything strange on me?
Well, not that I can think of. Why? Do you?
20 beats per minute is normal.
You seem to know how to do everything right. .98
degrees Fahrenheit is low.
this result could mean anything.
Low body temperature can be an indication of heart disease, liver or kidney failure, internal bleeding, low blood sugar, severe dehydration, shock, or severe infection. Use a blood test syringe on the animal's hind leg.
No wonder he's collapsing.
Extremely low glucose.
Matey's going to be fine. I just know it.
Low blood glucose values could indicate infection, poor metabolism, stress, starvation, insulin overdose, or hormone imbalance. Use a stool test.
He probably got this from his mother.
Fecal flotation is positive for hookworms. Hookworms are blood-sucking worms that live in the intestines. Puppies are commonly infected from their mothers. That's gross.
Give me a little sugar. Or at least give it to Matey.
Dextrose is a form of sugar and is used in the treatment of low blood sugar, hypoglycemia. Low blood sugar produces listlessness, low body temperature, and poor circulation. Administer IV fluids.
This'll get him back on his feet.
Administer oral medication with the patient's mouth. Eat this.
Take that,
Holy
hookworm.
moly. Puppy receives a dose of pyrantopamoate, a dewormer for hookworms and roundworms. The puppy is also large enough to receive a dose of nitenpiram, which will kill the entire flea burden in a matter of hours with no side effects to the puppy. These medications should clear the hookworm infection and flea infestation, and the puppy should recover from the anemia. We got hookworm.
I can't believe Matey was in such bad shape. It's so sad that the pet store didn't even notice his problem.
Then it's super great that you came along when you did.
I guess it is. But it's even better that you were here to help. Thanks.
Matey was suffering from hookworm, a blood-sucking parasite that lives in the intestine. His symptoms, however, stemmed from hypoglycemia because the hookworm was making it too hard for him to stay nourished. Medication should scare the hookworm off and allow Matey to grow up big and strong. The verdict is in. Your questions were you followed.
Don't get any more puppies, ma'am. Peekaboo, the Parson Russell Terrier. That's a cute name. Difficulty breathing and keeps vomiting.
Well, we have a winner in the non-stop vomiting sweepstakes.
Whoa.
Is there anything else we should know?
Like what?
Any other symptoms? Anything you can tell me about when it happened? How long has this been going on? Does this color look good on me?
I don't know. She was out playing in the backyard, and then...
I'm sorry. I'll let the doctor ask the questions, and everything will turn out just fine. Right, Doc?
Oh my god, Javier,
Dogs
you
are very normal.
are awful.
You think?
I could list all the potential causes here, but I won't.
No dental tartar buildup, no foreign objects in mouth, dark pink gums, excess saliva present in mouth. Cause of excess saliva includes dental disease, foreign body in the mouth, nausea, bad taste in the mouth, inability to swallow. Your rear, not your legs.
Well, bloody stool isn't the end of the world. It's just from the end of the dog.
Fresh blood in stool sounds dramatic, but in most cases it is caused simply by response to mental stress or dietary indiscretion, eating something unusual or exotic. Intestinal parasites should also be ruled out. Canine parvovirus produces a bloody stool, but the blood is not usually fresh and red, but more digested and dark brown. Check your pulse.
I think you're... right.
What? Oh, I forgot to ask questions. What else has Peekaboo been having problems with?
I think, she's been bleeding. Oh, when she goes to the bathroom.
Oh my god. Oh, has Peekaboo been acting strangely?
She, has been vomiting. I don't have anything to say.
Oh, who is this lady? Do you notice any injuries on her?
Oh. No.
Don't want her to throw up all over again.
Belly is tender and palpation generates some attempts to vomit. No distension. Try using the gloves on the animal's mouth.
Oh, dry mouth. She's not asking anyone out on a date.
Listen to your heart. 20 beats is normal.
I'm glad
Time
you're
to
here.
your tempi. 115 is normal.
I could never do what you do.
Yeah, you can't. Poopy.
Great.
Ah, I think I know what's going on here.
Bruh. Heartworm is strongly positive. A strong positive heartworm antigen test indicates the presence of many female heartworms in the pulmonary blood vessels. Often there are no clinical signs suggesting heartworm infection. Take an x-ray of the animal's anterior.
Sometimes I wish we really could speak to animals. Maybe someone would actually listen to me. She really took these to heart.
Adult heartworms live in... Wait, hold on. X-ray. Moderately tortuous and large pulmonary vessels are noted. The right side of the heart has some enlargement but is deemed not severe. Adult heartworms live in the pulmonary arteries where they obstruct circulation. The findings on the radiographs are typical of heartworm disease. Administer medications with a syringe in the animal's front leg. Heartworm is no joke.
Now this will treat the symptom, but not the disease.
What is your diagnosis, doctor? Heartworm disease.
Oh, did you want to say something?
Thank you for helping Peekaboo. I wish, you know.
Actually, I think I do. And you're welcome. We'll see you soon.
Mosquitoes probably infected Peekaboo with heartworms, although her owner might have prevented these parasites with a product you can buy in a pet store. If only a small number of worms had moved in on Peekaboo, you could have let the worms die off on their own over the course of years. Killing the heartworms involves the use of arsenic-like treatments, which presents hazards in their own right. Peekaboo was not so lucky. When her upset stomach improves, she will return for the main course, heartworm treatment. Thank you for identifying. You conducted
no
your
joke. Alright, next. Smitty. British short-haired kitten, 5 months. Unusual patch of scales on head. Ew. Is it gonna be, Demodex?
I was hoping you could help me out. I got a sick cat and a sick son.
We don't treat people here.
I know, but my cat here's got this gross spot on his face. Now my son's got something that looks similar. Know what I'm saying?
Uh-oh.
Got it. You heard the woman, doctor. If you can treat Smitty, you might be helping out a little boy as well.
It's, what's your
I've got another cat, but he's fine.
A comatose tarantula has arrived and needs your attention. How do you tell if a tarantula is comatose? What's that called? Not roundworm. The thing on the
I had to
skin.
arm wrestle Javi for this one.
I like to mix it up a little. Puppy adds spice to me life.
You named your tarantula Puppy?
It doesn't come when you call, no matter what you name it. 'Cause now you won't eat no matter how hard I try. It may be the end for Puppy.
Not if the doctor has anything to say about it. Doctor, ready for your first arachnid?
I've gotten a few looks for me choice of pet.
Are we even qualified to treat a tarantula? 3 ounces. Puppy, the tarantula. Cute.
You're doing a dead good job.
Is that some sort of liquid sitting on his web?
Ew. I'm learning. Okay. Hold on. A visible form of liquid is secreted beneath the skin. Pre-molt is when a liquid, exuvial fluid, is secreted between the old and new exoskeleton. These enzymes will digest a layer of the old exoskeleton, making it soft so the tarantula can squeeze out of it. This process is called ecdysis. Use a magnifying glass on the animal's abdomen. A spun web lies underneath the tarantula. The tarantula lies on a blanket of web The tarantula lies on a blanket of web shows a possible sign of molting. Use a magnifying glass on the animal's abdomen.
I must say, quite fine work.
Use a glove on the tank to remove the live fluid. Fluid?
We really are a full-service vet.
1 second.
Poppy's my first pet. I might get another.
This sign out. To help ensure successful molt, remove any live food, mist the substrate with water to increase humidity a bit, and make sure the water dish is full. You're molting.
Excellent. I wish I could regrow my skin.
You might want to wait until you can spin a web too.
You obviously haven't seen me at work, but I've seen you, and there's no doubt you did a stupendous job.
Oh my god, it's alive!
Like all other arthropods, tarantulas molt their exoskeleton periodically. The tarantula generally stops feeding for a week or more, and then usually turns over on its back. The old exoskeleton splits, and the spider works it off and then flips upright. Finally, the new exoskeleton enlarges and hardens. It will be several days before this last part is complete, and the spider does not eat, nor should it be handled during this time.
I forgot to ask the owner the questions.
You dig a little deeper next time. Your ex...
Alright. I don't remember what this thing is called on the skin. The worms
Just
on the
like Carrie said.
There's a gray scaly patch where the fur is missing on the left side of the muzzle and a similar spot atop his head.
I hope my son gets better too.
.28 beats per minute. This is normal.
You've got it all down.
One is normal.
After this is done, I have to swing by my son's doctor too.
Use a scraper to get a sample for the lab.
This will get to the core of the problem.
Ringworm, that's what's called. Under the microscope, ringworm spores are obvious on the hair shafts. A culture will be needed. Use the fungo test on the animal's nose.
Got it.
Culture is positive for fungal infection. Ringworm is confirmed. Make sure that this kitten has a normal immune system to fight the fungal infection. Use the blood syringe on the animal's neck.
I wish my son's doctor was as good as you.
And the fecal test. We're getting all the tests done.
Now we know Smitty can fight infection from within as well as we can from without. I dream about being a vet, but you already are one. I like to be thorough.
The owner will need an oral dose of lufenuron is given. The owner will need to be told how to deal with this infective fungi. Apply topical medication on the animal's head.
Here's what we can do. Carrie will do the rest.
Topical antifungal treatment kills the spores he carries on his body. Sign out. Wait, I didn't ask questions. Has Smitty been behaving normally?
With a cat? How could you tell?
Does your pet feel different when you touch him?
I didn't want to touch his face. I'm not sure, but I think my son might have, though.
Have you seen anything strange on him?
Like I said, he's got some scaly business on his face there.
You got ringworm.
Can't believe my cat got my son sick.
You're lucky you weren't infected as well.
Don't remind me. Nothing but gloves for me from now on, that's for sure. At least till Smitty's all cleaned up.
Smart lady.
The smart one is the doctor who figured all this out. Thanks.
People commonly call this condition ringworm, but in reality, a certain family of fungus causes this problem, in both humans and animals. On people, ringworm looks like a round red lesion. In animals, however, ringworm frequently consists of a dry, gray, scaly patch. Smitty will have to be isolated from the rest of the house while his owner disinfects it. Hopefully both Smitty and Carrie's son will soon be in the clear.
Disgusting.
I agree. You're excellent.
Who's next? Logan, a hamster. Difficulty breathing and blood around the eyes. That sounds bad.
We've got cloudy discharge from the nose, bloody crust around the eyes, and abnormal respiratory sounds. I'm guessing some sort of infection.
Oh, wow. You're a doctor too?
No, I'm a real doctor.
Wow. We'll get right to it then, for Logan's sake. Doctor, are you ready to show her what we're made of?
What do you mean I'm a real
Keeping
doctor?
a pet is a lot easier than taking care of patients all day long.
You think vets aren't real doctors, ma'am? Respiration 35 to 135, pulse 250 to 500, temp 102. Logan, you got blood around your eyes.
Just like the doctor said. The other one, that is.
This red material is actually blood. It is the pigment of the tear gland secretions. Do you mean it's not actually blood? Cloudy discharge suggests infectious disease. Palpate the chest.
He doesn't seem to be breathing right.
Respiratory crackles felt. Difficulty breathing. Abnormal respiratory sounds are an indication of disease affecting the respiratory tract. An X-ray will be needed. 85. That is low. Patient is breathing normally, but it sounds like he needs oxygen.
It can be hard to put a mask on a critter so small.
Whenever a patient appears to have difficulty breathing, administering an oxygen is advised. Take a blood test. On your neck.
I think there's infection afoot.
You have a lot of the same medical equipment as I do.
An elevated white blood cell count suggests a bacterial or fungal infection. X-ray the chest.
I can't come up with the answers right away either, but I bet you know what to do already. Ready to prove it? Oh, wow. No wonder he's not feeling well.
I did not mean to take one of the forelegs, but it's literally the same image. Lungs congested with patchy, cloudy areas. Patchy areas of congestion suggest infection. Try to determine the type of bacterial infection with a culture. Use a bacterial test on the nose, but it's so small.
Oh my goodness. It's not bacteria that's the real problem.
A Staph aureus infection. Mycoplasma pulmonis is a common respiratory pathogen of the rat. The bacterial infection is a secondary problem. Use a medication syringe on the animal's front leg. Oh, I forgot to ask questions again. Is Logan embarrassed about his runny nose? Have you noticed any other problems he might be having?
I've identified a red, bloody, crusty area near his eye, as well as some cloudy nasal discharge.
Does he giggle when you rub his belly? When you pet him, have you felt any injuries or lumps?
I did a cursory exam, but I didn't notice anything.
Have you noticed any abnormal behavior?
Logan has been breathing with some difficulty. Logan's normally a bit of a daredevil. Well, for a hamster, that is.
This'll stop those nasty organisms.
This tech is very enthusiastic. Antibiotics are administered. The mycoplasma organisms need to be killed in order for this patient to survive. Administer oral medication.
First of many.
Medication administered. Only time, medication, and care will determine whether this patient survives this deadly disease. Since he is eating, it is reasonable to treat him as an outpatient. Mycoplasma infection.
And I just thought it was a small infection.
You weren't entirely wrong.
That's kind of you to say, but about what I said before. I'm sorry I implied you weren't a real doctor. You showed me that I have a lot to learn. Thanks.
I knew we'd bring you around.
She
This
talks like
disease,
a Barbie.
called mycoplasmosis, attacks the respiratory system. In serious cases, even death can occur. Some may even have difficulty diagnosing this condition because other bacterial infections often accompany it. Antibiotics should keep symptoms well under control. If the owner stops administering them, however, the disease could return. Great job! Your There's room for improvement, but your treatment of this animal was great.
Shut up, ma'am. I meant to do the chest. And it took the picture of the chest anyways. Anna. The turtle.
How's it going, man?
Not too good for my number one lady here. She rules my place from her aquarium, but she hasn't been feeling me lately.
Are you sure she's the one with the problem?
Anna seems like she's tired all the time, unless I'm seeing something that isn't there.
She does look a bit puffy around the eyes.
There you go.
Could be a problem. Could be she didn't get enough sleep last night. Doctor, maybe you can get to the bottom of this.
No one
I
finds you funny.
actually named Anna after my mother. She loves turtles.
Pulse 20 to 50 BPM. No appetite and no energy.
I'm glad you do more than just mammals.
Body looks swollen. Examine the eyes.
Just as I expected.
Eyelids swollen. Low protein diet and lack of vitamins will cause swelling of the tissues. Palpitate the head.
Her skin's far too soft for a turtle.
Tissue edema. Tissue is soft to the touch and returns to normal position after being touched. Tissue edema helps confirm malnutrition. Hold on, I forgot to ask the questions. How fast can Anna run? Have you felt anything abnormal on her body?
Well, maybe her shell's not feeling rock hard like normal.
Has Anna looked different at all lately?
Maybe she looks a little puffy.
Have you seen any different behavior from Anna?
She's not her regular perky self. By perky, I mean turtle perky. She's not eating as much either.
Turtle perky. Your shell is squishy.
Her shell isn't even hard.
Shell is soft to the touch and can be easily depressed with little pressure. Diet inadequate in protein, calcium, phosphorus, and other essential vitamins cause the shell to grow very soft. Administer medication with a syringe in the animal's front leg. That sucks.
This won't make up for everything, but it's a start.
Vitamin A and D injections given. The injections will increase the uptake of calcium. The owner will need to be informed
My
that
iguana and Anna love each other.
The owner will need to be informed that the patient will need to be put under UVB light at home. Sign out. Malnutrition.
What do you know? It was my problem after all.
Yeah.
It may surprise you, but I didn't want to be right. Have you got a handle on it now?
Absolutely. Regular UV light, better vitamins, and Anna will be the queen of the roost again. Thanks, doctor.
Nutrition for a turtle means a lot more than just getting the right foods. Turtles thrive with regular doses of ultraviolet light, whether from the sun or a special lamp. Richard needs to increase Anna's intake of the necessities like calcium, protein, and phosphorus so that her shell can grow strong. Once he does that, Anna should return to normal.
Oh, Anna. Hold on, I need to save. I forgot that was a thing. I don't know how to save though. What is this? Oh, my little book. Return to waiting room. How do I save? It's a horse. It's a kitty cat. Oh, look at all these trophies. Terrific work. You saved the itty bitty kitty Smitty. Done. How do I save? Tools. Guide. Options. Oh, hard mode. In this mode, all tool and test results are presented as raw data with no interpretation. If you know the significance of O2 equals 98% or RR26, then this level is for you. If you ask for hints in this mode, you will lose points. How do I save? Oh, main menu. Save the game you're currently playing. College of Veterinary Medicine. Save game. That's very important. Please enter a name for your save game. Doctor Who, since that's our name. Resume. Alright, last one. Nico the clownfish, swimming upside down. Are you sure he's swimming? Are you sure about that?
Never thought I'd see myself bringing in a fish to the vet.
What's wrong?
I've either got a very talented fish that can swim upside down, or something just isn't right. Am I nuts? I can take the truth, whatever it is.
What's wrong with that? You care so much about your fish that you brought him into the vet. I wish more people would do that.
Okay, you've got me feeling better about myself. Now, how about Nico here?
I'm sure the doctor is one step ahead of you.
He's
You
dead.
think a clownfish would make me laugh, but it doesn't.
Less than 1 ounce.
That's weird.
That's weird. Appears to be thin. Test the water.
Whee! Now I'm a chemist.
What the heck? pH nitrite and ammonia levels are within normal range. This fish's problem is not due to improper water care. X-ray the abdomen. X-ray a fish? How do we do that?
It's hard to x-ray something so small.
X-ray is difficult to read, but it looks as if there's fluid in the swim bladder. This result suggests swim bladder disease. A diet of floating food may cause this. The owner will need to be informed. Oh, I forgot to talk to you. Does Nico ever try to escape his bowl? Has Nico been acting abnormally?
If swimming upside down isn't abnormal, I don't know what is.
When you look him over, do you see anything strange?
Not really.
When you handle Nico, have you felt any... What do you mean handle Nico? Does Nico ever try to escape his bowl?
It's fun learning everything you can, but getting to the heart of the matter quickly will help you in the long run.
But you don't handle fish.
Well, I like fish, but I wouldn't want to get into the habit of touching them.
Yeah. Do you think Nico ever tries to... Sign out. Swim bladder disease.
Okay, I'm not crazy, but maybe you are. Floating food caused this? How else do you feed a fish? Never mind. I'll take your word for it.
Will you also take our word to keep Nico apart from the other fish? At least until the medication kicks in, of course.
Don't worry. I won't even put them in the same zip code. Thanks, doctor.
What?
The swim bladder helps the fish swim up and down in the water. So if a fish isn't swimming well, then disease in the swim bladder is most likely the cause. No one's quite sure why this kind of disease occurs, but it may have something to do with the food floating in the water. After a short fast, a new diet should prevent the problem from recurring. The verdict: you have a nearly you followed Your patients have improved because of you, and now we want to recognize your efforts in keeping animals healthy and safe. It's my privilege to present you with the prestigious Animal Welfare Award.
Wow, thank you. I don't even know your name. Thank you, tutorial lady.
Hello, this is Mark, following up on my rat, Renfield, with the dental problem. Still busy, but I'm keeping an eye on him. He's eating normally and running around. Thanks for the eye-opener, and for saving Renfield.
It's me, Kimmy, with a puppy with nasty hookworms, remember? Ugh, Matey is running around the house as I speak, and I can't thank you enough for all the joy that he has brought to me and my family. Hi, it's Heather. Peekaboo stopped vomiting, and I think the heartworms don't bother him much. He's ready for the next treatment. But no more mosquitoes for him.
It's Nick. I thought I'd ring you up about Puppy. That's the tarantula, in case you've forgotten. He's been eating well since his new exoskeleton came sturdy enough. Thanks, Doc. Cheers.
Cheers.
Hi, Doctor. Remember that ringworm problem on my cat and my son? It took a while, but Smitty's finally got a clean bill of health, and so did my son, Scott. Thank you, Doctor, from all of us.
This is Doctor... Sorry. This is Patricia, following up on my hamster's mycoplasmosis. I've kept to a regular schedule, administering his antibiotics, and he's breathing normally. Thanks again for teaching this old dog a new trick.
You're welcome. Rhett, hold on. I want to groom some pets. Care for Abyssinian. I wish there was sound effects. Actually, no, I don't wish there were sound effects. I take it back. Where am I missing? Why did we groom and have a vet hospital? What is this? Let's start from this end. Cody the guinea pig, hair loss.
I probably should take him to the groomers, but you guys deal with hair too, right?
If there's a medical problem.
It's nothing serious. He's been losing hair. If you don't deal with that, I should leave.
Hold on. Are you the vet in here?
No, but I am a doctor.
When you've treated as many guinea pigs as the doctor has, then you can give an opinion. Until then, let's see what this doctor has to say.
Sassy.
If my pets keep getting sick, I may have to become a vet.
Okie dokie. Artichoke. Let's take a look.
Here's the problem. Now, what's causing it?
Generalized fur loss, but not affecting the head or legs. When entire patches of hair are missing, this is abnormal. Palpate the abdomen. Palpitate. Guinea pig noises.
I think his fur loss is just the icing on the cake.
The abdomen is probed and an enlargement is found. These enlargements are a clinical sign for an enlarged adrenal gland, which produces excess hormones which cause behavioral and body changes. Gotta get blood from your neck.
With those results, I'm surprised he's not attacking us.
Normally high amounts of adrenal gland hormones. Adrenal gland problems can cause certain types of fur loss and even aggression. X-ray the abdomen.
Exactly what you expected, right, doctor?
Enlargement in the area of the kidneys is seen. This is the area where the adrenal glands are located. This helps confirm the adrenal gland disease. Administer oral medication to the animal's mouth. Weak. Where's your mouth?
This is a start. Next comes the real work.
A trial of anti-hormonal therapy is given. If the therapy doesn't work, surgery will be needed.
I hear you also do exotic animals like reptiles. That takes something extra.
The removal of the disease gland will return the guinea pig to normal and the hair loss will grow back. Forgot to ask questions again. When did you first see something wrong with Cody?
The missing patches of fur started appearing recently.
Does Cody feel like a gerbil trapped in a hamster's body? Has his behavior changed lately?
No. Well, maybe. He has seemed a bit vicious lately.
Have you considered a wig for Cody? Have you felt anything strange on his body?
I did do a once-over and he felt a little swollen in the abdominal area, but he'd just eaten.
Sign out. Adrenal gland disorder.
It's nice letting other people be in charge.
I don't know what I was thinking, acting like I knew better than you. I forgot how fabulous you are with all my animals. Thanks, Doc.
Cody's fur loss actually heralded a more serious condition called adrenal gland disorder. The diseased adrenal gland grew too large and could have affected Cody's behavior as well as his fur. Once surgery removes the diseased gland, hormone levels will return to normal in Cody, and so will his hair. You reached the... Thank you.
Hugs, the Burman will not eat any food.
I just have one question. Okay, why did my cat's eyes change color? Well, that's because, well, I'm not sure. I have another question. She's not eating. I'll just ignore that that's not a question. You have me at a disadvantage, sir, but I'm sure the doctor will figure it all out for us.
If it helps Hugs, do whatever you want.
How often do you brush your pet's teeth? Do you ever listen to music with Hugs? Did you notice anything changes in Hugs?
Her
lately?
eyes turned green.
Has she been doing anything unusual lately?
Yeah, she likes to wander off, but she usually comes back okay.
Have you felt anything abnormal on Hugs' body?
No. I have a question. What is abnormal?
Okay.
That yellow tinge explains change in eye color. To me, anyway.
Jaundice? The patient is jaundiced. Icteric. This explains why the cat's formerly blue eyes now appear green. Check them out.
Yellow. Yeah, it's not her color.
Gums are yellow. Jaundice occurs in liver failure, obstruction to bile flow, red blood cell destruction, or with certain bacterial toxins. Check the pulse and heart rate. How old are you, kitty cat? – 7 years old.
Whatever you're doing, keep it up.
.28 BPM is normal.
I bet you're smart, too.
Use the thermometer on the rear. 98 degrees Fahrenheit is low.
A little low.
I have a question. Do you think Hugs likes me? All those numbers mean something.
This shows attempts by the liver to regenerate. Run a urine test. Oh my god, those are high values. Use the urine test in the animal's abdominal area. Shave area.
The source of the yellow.
High levels of bilirubin, but is otherwise normal. Bilirubin elevations produce the yellow color changes known as jaundice. Test the blood's clotting time in case surgery needs to be performed.
Surgery is officially an option.
God. Normal results. We are considering an invasive diagnostic on the liver and do not want to run into any excessive bleeding. X-ray the liver.
I don't know what you're doing, but it looks pretty good.
Mild enlargement of the liver is seen. Fairly non-specific finding. Also check the chest.
It is what it is.
With the cause of the liver disease still unexplained, it is prudent to rule out cancer spread. Try an ultrasound on the liver.
You think I asked too many questions?
Okay, so it's not cancer.
The liver is of even echogenicity, evenly reflecting the ultrasound waves. This indicates an infiltrative process rather than a tumor or abscess. Administer anesthetic gas for synthesis. Alright.
So she won't be moving around.
Prepare the abdomen for synthesis. I don't know what that means. See synthesis. It's not even here. Okay. Shave your belly. Ooh.
Can't jump right in yet.
Abdomen clipped. Clean the abdomen.
Almost there.
Shaven. What is up, Jirachi? We are about to cut into this cat, I think. Or synthesis this cat. I don't know what that means. Use the synthesis needle on the patient's abdomen. What is this? Draws fluid, gas, or cells out of a body cavity, organ, or abscess.
And here we are.
Lord, that's a big needle. Take a sample from the liver. Okay. The tissue cells are heavily infiltrated by fat and fat cells. This confirms fatty liver syndrome, hepatic lipidosis. This cat needs fluids and medication. Alrighty. Get some fluids, buddy.
Keep it flowing.
When an overweight cat enters a starving metabolitic state, the liver can't process the large amount of fat that is mobilized. Interesting.
These vitamins will get her back on track.
The cat receives vitamins, nausea medication, and antibiotics. The cat will require several days of hospitalization to stabilize. Alright, you got fatty liver syndrome.
I have another question.
Here we go.
Who do I thank for helping Hugs? I'm going to pass that one right on to you, Doctor.
Are you dumb,
I
sir?
hope you don't mind.
Surprisingly enough, Hugs suffered more from having a lot of fat on her bones than from not having enough to eat. The feline liver has a lot of trouble processing all that fat, and, as in this case, fails. A feeding tube can fill in the gap until she fully recovers.
Jesus. No chunky cats in this vet hospital. Jonah, pretty sure her kitten collapses in difficulty breathing at 8 weeks old, man. Unfortunate.
I left my son playing with Jonah here, and I came back, and boy, did I have another problem on my hands.
How long has he been moaning like this?
Ever since I came back, he can hardly keep his head up. I could really use some help here. I don't know how to handle this alone.
You're not alone with the doctor here. We'll give Jonah our all.
Ew.
Nothing like having a new cat in the house.
An extremely sick cat has arrived and needs you as soon as possible. Click on the emergency icon to go to him. Alright. Hold on, cat. Let me go to the other cat.
Oh, look at Patty.
She's been vomiting for a couple days.
Oh my goodness. How many days?
Look, I don't have time for a lecture. I have a lot of stuff I need to do. She ate some flowers, and I thought she would just, pass it through her system.
But she didn't.
Yeah, okay, you got me. Is there anything you can do?
Of course there is. The doctor will make Patty first priority.
Patty's dead.
Patty scratches sometimes, but it doesn't hurt.
Patty, how old are you? Oh, Patty with a D instead of Patty. Okay. 5 months old? Alright, have you tried talking with your pet? Have you seen anything unusual about her?
Not especially.
Have you felt anything typo. Hour of place on your pet lately?
Can't think of anything.
When did you first notice Patty acting strangely?
She's been sick ever since she got into the lilies I just bought.
Of course. I don't even need to do it.
More drool than normal.
I'd be too stressed to do as good a job.
What did this say? Kitten is drooling. The owner said lilies were in the arrangement. Look inside the mouth. Lilies are extremely toxic to cats, causing acute kidney failure. Gums are normal, but the kitten is drooling. Okay. Palpitate the gums.
Despite the drool, her gums are dry.
Alright, check the pulse.
Now, how do you find time to learn to do your job so well?
So well. Use the glove to feel the abdomen.
Something's making her uncomfortable.
Alright, listen to your heart. 28 beats per minute is normal.
Well, I thought I had it all figured out. I bought some lilies for my mother.
That's your first mistake. Oh, that is a low temperature.
What could be causing that?
Wait. Often animals with an excessive amount of urinary toxins in their bloodstream have low body temperature. Run a blood test.
Just what I was afraid of.
This is consistent with kidney failure. High BUN, high creatinine, high phosphorus, and high white blood cell count. The white blood cell count indicates the immune system is active. Begin fluid therapy.
Hopefully we got her in time.
Aggressive fluid therapy is initiated. Several days of fluid therapy will be needed at the hospital. Administer medication. Eat this.
I think she's going to be fine.
The owner should be informed about lily toxicity.
I can't believe I risked Patty's life because I didn't have time. You must think I'm the worst owner in the world.
Yeah.
You didn't know.
You're not mad at me? I am.
You brought her in on time. If you pulled that again, Then I might be upset.
It's not happening again, that's for sure. No lilies anywhere near Patty if I can help it. Thanks, Doctor, for saving her life.
It may come as a surprise to some, but cats experience a toxic reaction when exposed to flowers of the Lilium genus. Much like antifreeze poisoning, kidney failure could result. To make matters worse, cats may not show how sick they are at first. If they become unable to produce urine, the prognosis is grave. If cats receive treatment promptly with aggressive fluid therapy, however, recovery won't be far off.
Dang. That's serious. Oh, right, we were on this ugly kitten. What was your concern? Does Jonah like to play ball? Have you felt any bumps or bruises on him?
I haven't touched him, except to put him in the car.
Does he like to play with string? Have you seen anything else out of the ordinary?
Something nasty's going on in his mouth.
How long has Jonah been acting like this?
He's been moaning like that ever since I first saw something wrong with his mouth.
What is wrong with your mouth, buddy? Let's take a look.
Yeah, that's gotta be it.
Gums bluish, large red burn mark across patient's tongue. The bluish color indicates, yeah, we read that. The burn mark on the tongue is a classical finding in an electric cord bite. Ooh. Electric cord bites cause fluid buildup in the lung. Oh my god, that's awful. An x-ray is indicated.
Something's going on here.
Pupils dilated, eye membranes bluish. Dilated pupils can represent blindness, neurologic problems with the nerves that control dilation and constriction, effects from drugs administered, pain or fear. Alright, get some oxygen, boy.
Mask goes on without saying.
The patient appears less anxious. The initial obvious respiratory distress requires that the patient be given oxygen immediately. Check the animal's pulse by using the glove on the animal's hind leg.
Based on what we know, I'm sure this is no surprise.
Patient prefers to crouch and will not voluntarily
Funny
stand.
how cats can start out so small.
Check the patient's windpipe and pulse.
Could be bad.
Pressure on windpipe produces a cough, no mass is felt. Abnormal. In a normal patient, light pressure on the windpipe, trachea, should not elicit a cough. If a cough is elicitable, this indicates the presence of respiratory disease. 56 BPM, that is mad low. Oh wait, sorry, high. Crackles heard in the lung fields. Respiratory rate is 56 breaths per minute. The normal rest rate, the elevation in respiratory rate suggests difficulty breathing. The body is attempting to compensate by breathing more frequently. Crackles in the lungs is a sign of abnormality. A crackle is the soft snapping and popping sound made by closed airway openings. The presence of crackles indicates fluid within the airways of the lung. Take the patient's temperature. Booty hole. Give me your booty hole. That is low.
Still warm to me.
Pulse ox on your ears.
I believe it.
X-ray on your chest.
I'm a glutton for punishment. I've got cats and birds.
Curious pattern.
White pattern seen in both lungs. There are many causes for chest x-rays to show this pattern. Bleeding into the lungs, pulmonary edema from heart failure, pneumonia, or drowning. The burn mark in the mouth is highly suggestive of an electric cord bite. That's scary.
We give them all at once so he can feel better all at once. These fluids will alleviate the shock. No pun intended.
The patient will probably not be able to eat for a few days while the burn heals. IV support will be needed during this time. What is your diagnosis? Electric cord bite.
I only got 2 eyes. How am I supposed to prevent this from happening again?
Think inside the box. You give Jonah something to play with, like a box or string. He might pass up the electric cord next time.
Huh. You guys got it all figured out. Thanks. Again.
Cats love to chew on anything that looks like string, and an electric cord certainly fits that bill. The burn an electric cord leaves behind often means a severe wound with scarring. As with any exposure to electricity, The heart could also be severely harmed. Jonah responded well to the treatment, but he probably won't eat on his own for a few days while the burn heals. Thank you for identifying. You did a superb job in your treatment.
What did I mess up on?
That cats love to chew on.
I don't remember. Athena, 3-year-old rabbit.
I try to keep everything healthy. Mind, body, spirit. I couldn't let Athena live the opposite.
She seems a little quiet.
She refuses to eat. She's angry at me for not donating more to the environment.
What?
I'm pretty sure that's not the problem.
What?
You don't know her. She is wise beyond her form.
Why don't we see what wisdom the doctor can share? Ready, doctor?
Nice
My
transition.
rabbits possess both inner and outer beauty.
God. Alright, let's take a look.
Your brilliance shines clear.
She looks a wee nauseous.
Pulse time.
Oh no. Is she scared? She might not be getting enough water.
I need your abdomen, ma'am.
Feels like something's in there.
Belly uncomfortable, firm mass palpable in stomach area. A mass effect in the belly could indicate a tumor. Female rabbits are extremely predisposed to uterine cancer, but such a mass effect would be toward the rear of the belly rather than in the front. Pregnancy, large bladder stone, intestinal foreign body, or a hairball in the stomach. Rabbits are not able to vomit, and hair accumulation in the stomach is a life-threatening situation. Rabbits can't vomit? I feel like I've heard that before. That's so weird. An x-ray is indicated. Listen to the animal's chest. Oh, I keep forgetting to ask questions. Are rabbits social animals? Have you felt anything unusual when you pet her?
I've felt that she's trying to tell me something. Oh, is that not what you asked? I look forward to seeing my rabbits reunited.
Has she looked sick or hurt to you at all?
She looks beautiful.
Have you noticed if she's acting strange?
She hasn't been eating in a way that makes her happy, so she has seemed more aloof. I do think she's angry with me.
You are silly. Normal.
Your love for animals shows in how you treat my Athena.
"106 is high, buddy."
She's running hot. There is something there.
Large mass present in stomach. A large mass in the stomach of a rabbit that is not passing stool is consistent with a hairball. Hairballs, trichobezoars, are very serious for rabbits because they are unable to vomit. A hairball represents a life-threatening obstruction. Administer IV fluids.
She'll feel a little better soon.
Medication syringe on the hind leg.
Just in case.
Analgesics, I don't know how you pronounce that, and antibiotics administered.
Rabbits
Analgesia
are very spiritual.
and antibiotics
Not many realize that.
are needed to keep the patient stabilized. If an infection has not already set in, it usually could start if antibiotics are not administered. The rabbit is undoubtedly in some pain and will appreciate the analgesics. Administer additional medicine to treat the hairball. Use the medication syringe to administer medication in the mouth. Open up.
Gotta try everything before we resort to surgery.
Rabbits usually do... Wait. Feline hairball gel administered. Pineapple juice given. A stomach motility modifier given. Rabbits usually do poorly in surgery. Avoiding surgical intervention would be best. The hairball remedy consists of a gel that lubricates the hairball, pineapple juice, which contains enzymes that soften the hairball so that it may pass, and a motility modifier that normalizes contractions in the stomach to help move the hairball out. Dang. We got a hairball.
Pineapple juice. What a healthy and natural solution.
So you think she's not mad at you anymore?
I'm sure she isn't. I'm sending out that check today.
If you say so.
Rabbits, like cats, tend to swallow hair while grooming. Unlike cats, however, rabbits are unable to vomit the hairballs to expel them from their systems. That means we must employ other methods to save them from the serious consequences of a lodged hairball. Prevention in the form of pineapple juice or a supply of hay allows the forming hairballs to pass through the rabbit before they can cause any damage. If Athena doesn't get better, we may want to send her into surgery.
If they do poorly in surgery, not ideal. Astro, a Labrador retriever, keeps vomiting and collapsing.
He ate everything! Everything!
Ma'am, you need to calm down.
I'll be calm when there's something to be calm about. Are you going to do something about it?
Of course we will. And since you already told us part of the problem, there's no reason the doctor can't get started now.
The doctor can't get started. Have you considered low-carb diet for your pet? Has Astro been behaving abnormally at all?
Wish it were abnormal for this dog to want to eat us out of house and home.
How's your pet been sleeping? Have you found anything strange on his body?
His stomach is way too big.
Have you seen anything out of the ordinary?
Oh, come on. You can see his stomach is too big, right?
Do you have bloat, mister?
He's anxious to get started. Got some blue in the eyes.
Hold on. Third eyelids and eye conjunctiva slightly bluish. Bluish color is a sign of shock.
Blue gums get my attention. I wouldn't be comfortable either.
Grossly enlarged abdomen. This abdomen could be enlarged with fluids or air, or it could be enlarged due to a growth or problem with a specific organ. An X-ray may be indicated.
This dog's experiencing a lot of symptoms.
This and poor pulse quality are indicators of shock. This is a sign of premature ventricular contraction, PVC. Administering IV fluids would help to alleviate the shock. This patient may also need an EKG. Palpate the mouth and abdomen.
Sticky gums, slow cab test. We know what that means.
The capillary refills test, yeah. Dehydration. Let me feel your belly.
Stomach feels tight.
This is an indication that the abdomen is enlarged with air.
I can hardly hear anything. Sounds like a drum.
Abdomen is tympanic. A tympanic abdomen means that when it is tapped, it makes a sound like a drum. This is a classic sign of air in the abdomen.
Say goodbye to all those shock symptoms.
There's an EKG monitor on the patient's chest. It checks heart rhythm. It is applied to the chest and measures the electrical currents associated with heart muscle activity.
Kind of irregular, don't you think?
Abnormal. This indicates an abnormal heart rhythm. Most likely due to shock. Steps should be taken to restore a normal heart rhythm in order to prevent the patient from going into cardiac arrest. Use the thermometer on the rear. Low tempi.
That's low by any standard.
Use the pulse ox on the ear.
At this point, I'm not surprised.
At this point,
an animal could do worse than to have a dog like you. We have to get his heart beating normally.
Lidocaine administered. It helps to correct the abnormal heart rhythms. Take an X-ray of the posterior.
I hope you know what that means.
Stomach is extremely enlarged with air and appears to be divided into compartments. X-ray is abnormal. This is an unmistakable sign of a condition called bloat. The stomach is twisted, which divides it into 2 air-filled compartments. It is critical to release the pressure in the stomach using either the orogastric tube or the Syntensis needle. Use the orogastric tube in the mouth. Ugh. Oh, it's I forget what these are called.
Something is stopping the tube.
Intubation unsuccessful. Dude, we're not gonna sedate the pet before doing this. The orogastric tube cannot pass through. Another means of releasing the air pressure is needed. Use the clippers to shave the fur on the patient's abdomen. This is more like a medical emergency than than something you should be waiting in the waiting room for.
That might not have been the best way to achieve your goal.
Your abdomen.
This could be a hard case, so keep trying. Perhaps there was a better way to go about that.
Where's your abdomen? Shave area. There you go. Is it shaved? Are you fully shaved?
First step done. Second step done.
Third step done.
As bad as it smells, that's as good as Astro will feel.
Foul-smelling gas and fluids released from the stomach. Abdomen is seen decompressing. When the stomach decompresses, normal circulation is restored and the patient improves dramatically. Use a blood test syringe on the animal's hind leg.
We like to be thorough.
Results vary from normal to abnormal. Some blood testing is mandatory before a patient may be transferred to surgery. The elevations in BUN and creatinine seen here are consistent with recent poor circulation to the kidneys. Sign out. You have bloat.
Even I thought I was overreacting before, but Astro really could have died?
Not when you brought him in right away. I'll give that to you. You got a handle on yourself now?
As long as the doctor's got a handle on Astro.
You'd think the food itself causes bloat, but actually it's the air trapped in the stomach. After dealing with any shock and restoring the circulatory system, releasing the air in the stomach will dissipate this condition. That said, you might want to follow up with exploratory surgery to make sure everything is all right. The risk of death from this condition increases if any complications are present. That you didn't. I appreciate your fairly good treatment of this animal.
I'm trying to hair clipper the abdomen, silly. Go up. Oh, back right leg. Anyways. Last one. Rhett. Difficulty urinating.
Sorry we're late. I had a little trouble getting Rhett here since he wasn't feeling so well. Were you?
You said there was blood in his urine?
Yes, I did. Yes, I did.
Yeah, that's alarming on so many levels.
You can help with that, right?
Oh, we can help your dog for sure. Anything else? Well, I'm more than ready if you are, Doctor.
Anyways.
Brett loves to watch old movies. Well, he barks at all the musical numbers.
You are silly.
He's not happy.
Palpate your abdomen.
Did you feel that?
Belly is tender and the dog flinches when it is palpated. A very hard, large urinary bladder is palpable. Sounds like you got stones, buddy. Check his pulse.
I wish I could take you home to help a rat all the time.
Beats per minute, normal.
Sounds anxious.
Oh, ask questions. Does he like to ride on fire engines? Has he been acting strangely
I
at
don't
all?
suppose so.
Did you see anything else out of the ordinary?
There's been some red in his urine. Not something I like to talk about, but what can you do?
How have his bowel movements been?
He seems to be straining a bit when he tries to use the little boy's room.
Not the little boy's room. Butthole. That's a low tempi.
I hope you know what to do next.
Use a urinary catheter on the patient's abdomen area.
I just bought a lovely little dog bed for Rat. Why, it's just the cutest.
I'm gonna take a guess and say that was a problem.
The catheter meets a gritty obstruction, but by flushing saline through, bloody urine with greenish gritty material excreted. Ew. Passing the urinary catheter is a life-saving procedure. Take a blood test.
We're already on our way to fixing that.
High elevations are consistent with kidney failure, urethral obstruction, or poor circulation of the kidneys. Test the urine.
I'm not surprised.
Large amounts of red blood cells in a sample and an especially large amount of uric acid crystals. That needs to be rehydrated. Get in there.
At least we won't have to worry about dehydration. Infection is the last thing we need.
Posterior.
Well, only one option left.
Numerous bladder stones are evident. This will require surgical removal. The owner will need to be educated on the dog's new low-protein diet. You got bladder stones with urethral obstruction.
You heard the doctor. Rhett should be fine.
And he wants to give you a kiss for it. Isn't he beautiful? Isn't he? Go ahead. You know you want to.
Yes, you are.
Jesus Christ.
Thank you for bringing him in.
Rhett was battling a case of bladder stones with urethral obstruction. In any other breed, uric acid, a urinary waste product, converts into allantoin, which dissolves relatively easily. A Dalmatian, however, lacks the enzyme in charge of this process, so the uric acid can form into hard crystals. Male dogs are especially susceptible, and obstructions due to these crystals can become life-threatening. With a diet low in protein and regular vet checkups, Rhett will get the upper hand on this problem.
Yeesh.
Everyone is so impressed with how well you've been doing that the vet techs wanted to get together to give you the special award straight from them. They love how well you treat the animals and feel privileged to work beside you. I would love to grant you the first annual Veterinary Technicians Award.
I'm the only vet here, though. I don't know what this lady's doing. Dude, Achille got so many trophies. Her work is flawless. It was slow going on this hard case, but the turtle is feeling better than ever. Terrific work. I read that. You're a hero for helping Hugs. Dynamite job. Heroic work. You make happy happy. Amazing work. You really got style. Thanks for... This trophy looks god-awful. Thanks for helping keep Matey ship shape. You kept this boxer from going down for a 10 count. Your treatment of Athena was divine. Flawless work. Your skills are amazing. What is wrong with this guinea pig's eyes and face? I guess those are the whiskers. A bird. Swelling on left leg. Alright, we're speedrunning the rest of this game.
I don't know what is going on, but somebody's got it in for my pets.
I noticed some bleeding on Molly's leg. Do you think something hurt her?
No, I just feel like I spend more time here than at home. Know what I'm saying?
Doctor, I see a lump. I think we need to get started now.
It can be a lot of work keeping 2 cats and a bird.
There's that lump.
Lord, look at it. I'll peek the leg.
Nearly bit me.
Touching the lump indicate a firm mass and cause a pain response. Prepare leg for sentences.
Gotta keep clean.
Bro, I think I need to sedate this bird first.
That's pleasant.
Drying out lump content shows cottage cheese-like substance. This confirms the diagnosis of an external abscess. Gross.
It's a start.
Oh, that was so fast. What type of food does Molly like best? Can Molly say words? Have you spotted anything else strange?
Aside from that lump on her leg, nothing.
Have you detected any cuts or bruises on
I
her?
didn't want to touch where she was hurt.
Has Molly been acting out of the ordinary at all?
Aside from hurting herself in the leg? Hope it wasn't the cat.
Sign out. External abscess on leg.
You really pulled me out of the fire again, Doctor. Thanks.
We're just doing our jobs.
Now, I mean this in the best possible way, but I hope I don't see either of you for a long time.
At least until your next regular checkup.
All right, but not a minute before then.
Molly has an external abscess on her leg, probably as a result of her housemate, the cat. It's likely that a scratch was the cause of the lump forming on her leg. With proper treatment, Molly should be just fine, and hopefully, she'll also learn to keep her distance from the cat.
A parakeet, crystal eyes and beak.
Thank you so much for being here. You'd think it'd be easy to find a vet who treats birds. Aren't they common enough? I know all my friends have birds too, and...
That's great you found us. But is there a problem with your bird?
You thought I'd forgotten, didn't you?
No, I just...
Good, because there's something wrong with her beak. Can you see it? Oh, of course you can. Look who I'm asking. She's also had a little diarrhea. Now, should I just leave Rose here?
You might want to leave the cage, too.
Full service vet? I'm very impressed, Doctor. I can't wait to see what you can do.
Her accent.
My friends joke that Rose likes to chirp as much as I do.
Lila talked about this.
Upper beak is extremely long. There's lots of white crusty material along the non-feathered skin adjacent to the beak. The common facial mite of parakeets is known as Nemidocoptes pillae, and it causes nemidocoptic mange. Clinically, there are beak changes. Beak grows abnormally and white crusting along tissue surrounding beak and eyes. Time to look at your butt.
This cage needs a good cleaning.
In the cage, the droppings seem large and watery. Some contain whole seeds. A well-gnawed cuttlebone is present, and the food dish is full of appropriate seeds and grains. Some partially eaten fresh vegetables are also present. Avian physiology and anatomy is totally different from that of mammals. Birds have one opening to serve as their reproductive opening, the rectal passage opening, and the urinary opening. This opening is called the cloaca. Bird droppings consist of a urinary component, which is usually white and can be quite liquid in the normal state, and a fecal component, which is usually green and relatively solid. With diarrhea, as this bird is showing, both the green and white portions of the droppings will be watery. Look at the patient's eyes with the magnifying glass.
Oh, I hope she can still see okay.
The eyes are checked for swelling, discharges, and opacities. Some of the crust from the beak extends up to the eyes.
I don't know if I've ever gone this long without talking.
The heck?
Nothing too serious here.
The feet are checked for swelling or injury associated with the leg band. The feet seem to have a normal ability to grasp the perch. The joints are not swollen. There is some evidence of crusting on the animals on the legs similar to that found on the beak. Budgies are small and can injure their legs easily, and improper footing can also cause damage to the tissues. Often when budgies have an abdominal growth, it will interfere with circulation to the feet. Budgies also commonly get gout and deposit uric acid crystals in their joints, so joint swelling should be ruled out.
Not fun for Rose, but we learned something.
Budgie is famous for growing cancers of an assortment of types. It is very important to check for any lumps that the owner may not have noticed. When removing the bird from the cage for examination, it is important not to grab him with a hand, as this can lead to the bird becoming fearful of hands. Listen to the animal's chest using the stethoscope.
Oh, what a lovely job you're doing.
Lovely. Lungs and air sac sounds are heard. Use a teeth scraper on the animal's beak.
Now we'll know what this is.
Beak is scraped. Multiple K. pillae found moving around on the microscope slide. K. pillae are mites
Maybe I should get another bird so Rose can chat with someone.
Easily visible on microscopic examination of affected tissue. Use the fecal test on the animal's rear.
Have you got it all figured out, Doctor?
Giardia trophozoite are found under the microscope of a fresh fecal smear. Giardia are flagellated protozoa that infect numerous animal species, including humans. This is undoubtedly the cause of the diarrhea. Use the medication syringe on the chest.
I bet when you're done, Rose will sing for you.
Ivermectin administered under the skin, subcutaneous. Ivermectin is a mite-killing medication. Administer medication with a syringe on the animal's mouth area.
I think the mites hurt more than the syringe.
This treatment should be easy to administer at home, but should be effective in clearing the diarrhea. The owner... Oh, wait. Oops. Not at the beginning. Metronidazole is mixed into an oral solution for oral administration twice a day for a week to 10 days. An oral vitamin E supplement is included. The owner should consider changing the bottled water to bottled water for this bird's normal water supply. Apply topical medication to the mouth area.
Lila will need to know about this medication as well. I can't wait to see our friend all better. Let's get going. All's not lost. Keep going.
With the right leg? Whoops.
So many ways to cure this condition.
Mineral oil helps to suffocate mites, thereby killing them. Combined with ivermectin treatment, this helps to treat the disease. You got... Give me play.
Here I was going on and on about how hard it is to find a good vet, and I could have saved Rose a lot of discomfort if I had kept her cage cleaner.
You did your best, and some infections can occur no matter what you do.
You're so kind to say so. You're just like my friends. I should tell them about their bird cages too, just in case. Thanks, Doctor.
This poor bird was suffering from both diarrhea due to infection and what some people call scaly face. Scaly face occurs when a facial mite forces a white crust to grow around the beak. We can blame Rose's other problem on a Giardia infection. It causes not only diarrhea, but itching in some birds as well. Both problems spread through contaminated water, so Lila will have to keep a close eye on what Rose drinks. She has another reason to do so. If the infection recurs, it could spread to other animals, or even herself.
Ew. Done. Hera. God, not this lady again.
Who's a beautiful bunny?
Don't talk to her that way. She prefers it when people address her as an equal.
Oh
okay, Hera. What seems to be bothering you today?
Her ear. She won't stop scratching her ear.
Oh my God.
Perhaps she is trying to tell me to listen more.
Maybe so, because now we're going to listen to what the doctor has to say.
My rabbits enjoy our talks as much as I do.
You have to address her as an equal. Don't talk to her that way. Okay, extremely ill dog. Bye, Hera.
Please help.
Oh, this lady.
Help with what?
Sasha is sick.
You've got to tell us more.
But I don't.
We can't help him if we don't know what the problem is. Just say it.
Speak up.
He hasn't been eating and his back legs keep collapsing under him.
That wasn't hard. Doctor, I hope that was enough for you to start with.
Sasha could never hurt anyone.
Does your pet like wearing clothing? Has he seemed different lately?
He seems tired. He can't even lift himself up, it seems.
Have you felt anything strange when you pet him?
No.
Have you had Sasha count backwards from 10 to 1? Is Sasha taking any medication right now?
Something for heartworm and fleas.
How old are you, Sasha? 6 years. Alright, let's take a look-see.
Those membranes shouldn't be that color.
Oh my God, your nose.
Something serious is going down.
Yeah, bloody nose. Is that bloody nose? White gums. White gums? Dangerous loss of red blood cells. Take a closer look.
This
your
may be
nose.
more than just a nosebleed.
The causes of bloody nose include blood clotting abnormality, foreign body in the nose, trauma to the nose, or tumor in the nose. Ew,
Someone's home, but the lights aren't on.
What? The patient appears to be aware of his surroundings, but can hardly stand up.
You seem so confident.
We better hurry.
Wash in your mouth.
Where did all his blood go?
Where did all his blood go? Out his nose. Okay. Gums are too pale to measure capillary refill time. Where did all his blood go?
Strange. There's no pain.
There are many... Wait. Belly enlarged, no tenderness or pain. Pressure is applied to slow the bleeding. There are many causes of an enlarged abdomen. The abdomen could be enlarged with fluids or air, or it could be enlarged due to growth or a problem with a specific organ. Alright. Beats per minute is normal.
That's good news, at least.
Let me check your booty hole. 98 degrees is low.
I'm stumped.
Let me get your blood.
Highs and lows.
Use clippers on the abdomen.
Try again. Maybe you'll fail again. But at least you'll fail better.
Shut up.
Sasha sometimes drinks from my cup.
Ew.
Ready for the next step? Clear. That explains all the blood.
Ew. Pure blood tapped from the belly. This patient has been bleeding into his abdomen. It is important not to drain the belly of blood as it can be reabsorbed by the body. Use a clotting test syringe on the patient's front leg. Okay.
Now for some clotting action.
The PT and PTT represent the ability of different blood proteins to affect blood clotting. The PIVCA test is a test for the vitamin K associated clotting factors. Test results are made abnormal by liver disease and by the presence of rat poisons. Uh-oh. You need a blood transfusion.
Stop the blood here, and hopefully it'll go where it belongs.
Whole blood transfused. PCV rises to 25. Temperature rises to 100. Patient becomes much more alert, begins to eat and wag his tail. Although the patient rapidly improves after transfusion, additional treatment is needed to prevent further bleeding. Here's some meds.
Let's see how this does.
Vitamin K1 is an antidote for rat poisoning. Alright.
Can't read it. Can you?
X-ray is difficult to read due to fluid in belly. Another method is needed. Try an ultrasound.
There's a lot going on in here.
Patient belly full of fluid, small spleen. The patient's spleen has released its store in response to the eternal bleeding. Sign out. Go home. Rat poisoning.
All done. You don't have to say anything now.
But I do. I never thought he was poisoned. Thank you, doctor, for saving him.
Sasha put his nose somewhere it didn't belong and got poisoned because of it. When a rat poison prevents vitamin K from clotting the blood, internal bleeding occurs. In most cases, the owner only notices paleness, weakness, or a cold body temperature. Fortunately, we can easily administer vitamin K as an antidote.
Or antidote. Alright, back to crazy lady with her bunny.
Her ears must really be itching.
Something in the ears is causing intense itching. The ear scratching caused the skin lesions. Check the ears more closely. With the otoscope.
Oh, no wonder!
Blackish brown secretions with areas of white crust and inflamed canal linings. are seen in both ears. These findings are usually caused by ear mites, which bite and suck blood. The ears will need to be cleaned and treated.
Nice and clean.
Apply medication.
Might be gone.
The medication kills the ear mites, soothes and decreases the inflammation inside the ear. The medication will need to be applied for a couple of weeks until the mites are gone. Did I talk to you? How much does she eat? Have you seen anything physically wrong with her?
I must admit, I didn't look closely.
Any changes in her behavior?
She's constantly scratching at her ear. I wish I could take away whatever ails her.
Have you felt anything strange when you pet Hera?
I felt a strong feeling of annoyance. Does that help?
Alright, get out of here. You got ear mites.
I'm listening to Hera right now, and she's happy to know those mites will be going away soon.
That's gotta be the first time I've ever heard someone say that.
Really? I'm surprised you don't hear it all the time. You're a wonderful vet, Doctor. I bet all your patients thank you.
Hera was hosting an ear mite infestation. Ear mites look like dirt inside a bunny's ear, but you are most likely to identify them by the brownish scabs that form as a result of the animal scratching. Some store-bought ear drops will kill off the ear mites. The topical medicine you give to Alicia will no doubt do the trick within a couple of weeks.
Leonardo.
Well, check him out. Leonardo got himself into a little tussle. You should see the other guy.
Is that note of pride in your voice because of the gaping wound on his front right leg? Or the idea that the other guy might be even more injured? Oh, wait, don't answer that. I don't want to know.
Okay, maybe that came out wrong. I'm not glad he's hurt, but cats will be cats.
But must their owners be their owners?
I brought him in, didn't I? I want him to get better.
Oh, there's something we agree on. How about you, Doctor?
God.
I sometimes wonder if I even have enough time for pets.
Derp. Seem normal.
Oh, somebody took a bite out of Leonardo.
The leg has a wound from which pus is dripping. Palpitate the leg. Camera feels normal.
Leonardo didn't like that, so we're on the right track.
Leg is painful when manipulated. Check the pulse and the heart rate.
You never cease to amaze me.
This dude... 20 beats per minute is normal.
You never miss a step.
Check your booty. 103.5, that's high.
I'd probably be running a fever too.
Patient, the cat has a fever. Prepare the wound for treatment. Use a clipper near on the wound.
I might have done something different.
This guy giving Big Kuwabara Yu Yu Hakusho energy. He really does, actually. Except he's way more insufferable.
Need to clear the way a bit.
Kuwabara, clean the wound. There.
Okay, now stay still. You don't want any infection.
He brought his...
You ever wake up to a cat purring in your face?
The first pet he brought us was this rat named like Remington. Like he had another cat.
Here we are.
And now this cat.
If I'm distracting you, just let me know.
Cold compress inappropriate applied? What do you mean? I did it on the wound.
We make mistakes, but we are not our mistakes.
Remington Ratatouille. His teeth were too long, so he couldn't eat properly and had diarrhea. Apply the compress on the wound. Oh, regular compress.
Now we can get rid of the bad stuff.
We make mistakes, but we are not our mistakes. Is that what the guy said? I was not paying attention. Bandage the wound.
Well, we're on the home stretch.
Check for viruses.
Well, that's lucky.
Oh, I forgot to ask him questions. I always forget to ask them. Wait, hold on. Not the crowbar guy. Oh, it's probably the tech then. His name is Javier, aka Javi, and he is the sassiest dude. Like, I don't know why he's like that.
I would love to be a cat, just for a day.
A feline leukemia feline immunodeficiency virus test is negative. These viruses are especially transmissible among outdoor cats who fight. Have you seen abnormal behavior from him lately?
I don't know if it's abnormal, wink wink, but I heard him and another cat having a hissy fit. Literally.
Why the wink wink? Have you noticed anything else unusual about Leonardo?
That wound on his right front leg is starting to smell a bit.
Ew. Has your cat ever attacked a mailman? Does your cat drink a lot of milk? Did you feel anything strange on your pet?
Feel something? No.
No. Sign out. You have bite wound on leg.
What can I say? He's pretty tough.
Oh, he should not be running
pretty
around.
Lucky. If he had gotten something like feline leukemia, we'd be having another conversation. Or maybe the same one, except you wouldn't be smiling.
So I tried to make him more rough and tumble than a cat should be. I get it.
I knew you were smart.
The
The
bite
way
might
he
not have
moved, the
affected
way he
Leonardo
wiggled.
as much if it hadn't formed into an abscess, which occurs all too frequently in cats. When the skin heals more quickly than the lower tissues, it effectively seals the infection in. Eventually, pus erupts, and the infection leads to fever. Vets need to pay extra special attention because the bite wounds almost always come in pairs. If you don't see it the first time, look again. Abscess bite wounds usually heal uneventfully unless an immunosuppressive virus is present.
That sounds deadly. Alright, you. Julian, Dalmatian, foaming at the— Dude, you got rabies! Get this dog out of here! Foaming at the mouth, bro? Oh my god.
I got here as fast as I could.
What did you do to your dog?
What did I do? I spent time with him. I ran with him. I showed him everything in nature that he couldn't find at home. What didn't I do?
That's a nice speech, but your dog is unconscious. Can you tell us what happened?
I was hoping you could figure that out. If you'll excuse me, I've got to cool off.
Oh.
Okay, doctor. You got your work cut out for you. Ready?
I work from home, so I'm with Julian all the time.
He doesn't look that unconscious to me, but also I had this dude and his dog waiting in the waiting room for God knows how long. Your dog is unconscious. Your dog needs to be put down. I'm sorry to
Poor
say.
dear is down for the count, seeing blue.
Pupils do not respond well to the light. Okay.
Is that a bruise?
Okay. Mild dental tartar. Mild bruising seen on gums. Bluish color indicates, no oxygen. Sudden bruising is a sign of sudden platelet dysfunction. Sudden platelet dysfunction is suggestive of a severe blood clotting derangement called disseminated intravascular coagulation, or DIC. A very high mortality rate is associated with this complication. DIC occurs secondary to such conditions as pancreatic inflammation, blood vessel tumors, heat stroke, and snake bites. This dude was waiting in the waiting room for forever. Not your hind legs. I need your posterior.
I hope we can save him.
Bloody diarrhea erupts during exam. Ew. Bleeding regularly constitutes a clinical evidence of bleeding. DIC
I think it was near 100 degrees today.
Oh god. DIC is diagnosed based on the presence of 3 of the following 5 findings. Reduced platelet numbers, clinical evidence of bleeding, increased bleeding times, the presence of what are called fibrin degradation products. This is not practically measurable in an emergency setting. Reduced blood levels of fibrinogen, a substance the body uses in producing blood clots. Check the patient's pulse using the gloves on the hind legs.
Heart's not beating to any tune I know.
Pulse quality poor and thready. Pulse rate 200, abnormal rhythm, skipped beats, felt. poor, weak, or thready means the heart is not pumping strongly or that the heart is not filling well. In combinations with other consistent shock findings, poor pulse quality is an indicator of shock. An abnormal pulse rhythm indicates an abnormal heart rhythm and should be pursued with an EKG test. Elevated heart pulse rate can indicate anxiety, excitement, pain, blah, 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 blah. Palpate the mouth.
I know what dry gums mean.
Okay. Let's listen to ya.
His heart skipped a beat, but I don't think he's in love.
What?
Hopefully, this will turn the tide.
EKG on your chest.
That's really unsteady. What to do?
On my walks with Julian, I love to enjoy the beauty of nature.
Okay. Your dog is unconscious. 106.5, that is so high. Your dog has brain damage, I think.
Wow, he's really hot.
Causes of high temperature. Use the pulse ox.
He's probably in shock.
Get some more IVs.
Lidocaine will solve part of his problem. Sometimes the simplest treatments are the best.
Body temperature as high as 106 can cause brain damage. It is important to cool this patient down immediately.
You have the skill of a doctor and the grace of a gazelle.
What? Has Julian been acting strange?
Today we went on our morning walk later than usual, and he fell unconscious within 20 minutes.
Did you see anything different about him lately?
I've never seen him foam at the mouth before. It's weird.
How did he feel when you picked him up?
When I picked him up, he seemed hot. But then again, so was I.
You have heat stroke. You have multiple personalities.
I did everything for Julian. Everything with him. And that was the problem, wasn't it?
No, it was you taking him out in the heat. That was the problem.
I deserve that.
Look, it's obvious you love your dog. Just remember taking care of him is as important as loving him.
I'll make sure I do both from now on. Thank you, Doctor.
The dog Julian was suffering all the symptoms of a severe case of heat stroke. Heat stroke commonly occurs in large dogs in the early summer when owners tend to overdo exercise. When a dog's body temperature exceeds the dog's ability to pant, he no longer has any means of dissipating the heat. He will collapse with muscle cramps and headache and may experience irregular heartbeat, vomiting, diarrhea, and even coma. Sometimes this condition causes the body both to clot and bleed internally, which could be lethal if the patient goes untreated. Early intervention by hosing off and cooling the patient can prevent more serious side effects.
That is dangerous. Alright, I hope this one's not an unconscious dog. Keeps vomiting and refuses to eat.
I know what you're thinking.
Well, I've never met a psychic, but give it a shot.
You're wondering why I'm showing up again with another pet, but here's the situation. Sage has been throwing up for the past several days, and...
Yeah. And your first thought was that he'd get over it, and that maybe if you stopped feeding him table scraps, he'd be okay, and if he got enough sleep, he'd be fine.
Okay, now you're psychic.
Yeah, well, I cheated. It's the same thing with every owner, but I don't have to be a psychic to know that with the doctor on your side, Sage will be just fine.
Sage is dead.
Never leave a dog with anything small. Puppies are the best, most annoying pets in the world.
Maybe he doesn't like your hand.
Okay.
Well, it doesn't take a psychic to figure out he's hurting there.
Belly is tender, no distension. 20 beats per minute, normal.
When I see you work, I think, wow, what have I done today?
115 is normal.
If you think you're doing it wrong, you're crazier than I am.
Man,
God.
that's gotta hurt.
Object detected inside the stomach. A foreign body is evident but cannot be identified. A contrast radiography is performed on the animal. Delayed emptying of barium could indicate a partial obstruction of the stomach. Give me your blood.
Could be better.
God. IV fluids.
Hope this'll tide him over.
Oral medication. Oh, I forgot to ask the questions. Does Sage seem anxious lately? Has anything looked out of the
His
ordinary?
belly might be a bit bigger than usual.
Has Sage done anything out of the ordinary?
Now that you mention it, my cousin came by with her baby. Sage was playing with some of the toys, and it was right after that he started getting sick. I don't feed Sage table scraps too often.
Did you feel anything abnormal?
He doesn't want me touching him right now.
Take some meds.
I bet you're proud of what you do.
Sign out. You got a foreign body.
Okay, now I'm getting a psychic flash.
I can hardly wait for this one.
I'm sensing that soon I will be taking home a healthy dog after thanking the doctor profusely.
Well?
Thank you, doctor. I really mean it.
The little tail wag.
Sage bit off a bit more than he could chew. In his case, he started having problems right away. Foreign bodies can remain in a dog's stomach for weeks to months, causing only intermittent problems. If inducing vomiting doesn't work, the best long-term solution involves surgery or endoscopy to remove the blockage. Once that small toy is out, Sage's recovery will hopefully proceed without any problems. What can I say? Your treatment with all your patients has been exemplary, so you've left me with no choice. It's with great pleasure that I present you with our highest honor, the Excellence Award. You've certainly earned it.
Yeah, I'm pretty freaking excellent. Dude's got a snake jugger. Difficulty breathing and not eating.
My sweet Jugger hasn't been eating well since he went on a little adventure. Isn't that right, Jugger? I'm so glad you would treat a reptile, too.
That makes one of us.
You don't like snakies? Why would you play favorites?
Well, we don't, of course, but let's just say I drew the short straw. Doctor, are you ready to treat this snaky? Yeah, python?
Stop being a
Some
hater.
people are afraid of Jugger. I don't know why.
Jugger's just a little big guy, man. Look at him.
He's thin, even for a snake.
Isn't shedding well, has spectacles over eyes. Snakes are especially prone to disease while shedding. When snakes shed, they shed every external skin cell, including their external eye layer. When their eyes do not shed properly, the remaining eye cap is referred to as a retained spectacle. The spectacle can be carefully removed after 15 minutes of moistened cotton compress. I feel you, buddy.
I'd expect this snake to be a little stronger.
The snake palpates thin with muscle atrophy. He does not grasp strongly to support himself when held. A normal snake will grasp with its body in an effort to secure its position and prevent falling. This snake is not grasping as he is weak. The poor muscle mass indicates that this snake may have been sick before he was lost, but the stress of cold temperature may have brought a subclinical illness out to a more serious state. Take the temperature on your rear. How do I do that? Where's your rear? Posterior.
He's too cold-blooded.
65 degrees, pretty low.
Do you hear that?
Wheezing sound heard. When snakes develop respiratory disease...
My dog China likes to watch Jugger.
A wheezing sound can often be heard through the stethoscope. Examine the snake further for infection.
If that doesn't prove it. This disease has spread far.
X-ray shows disease affecting 2/3 of the lungs. Only 1/3 of the lungs is unaffected. Blood test syringe on the chest.
White blood cells are working hard, it seems.
Apply medication using the medication syringe on the abdomen.
No better way for Jugger to get these, and he needs them.
Apply a warm compress to the abdomen.
You're helping Jugger and me.
Apply a warm compress to the chest.
Jugger would be impressed if he knew.
And the back.
He'll be warming up in no time.
What country is Jugger from? Do you see anything abnormal about your snake?
He's got some snaky skin on his eyes.
How's Jugger been behaving?
Jugger snuck off when his little home broke. Now that he's back, he won't eat. And he likes to eat. Heck, I like to eat.
How often does Jugger, when you cuddle with
Jugger
Jugger,
likes to eat, except when he's sick. He doesn't want to cuddle anymore.
Okay. You have respiratory infection.
I can't wait to cuddle him again.
You, really do that?
Don't you like to cuddle your pets?
Oh, I wouldn't use the word cuddle.
You're a softie. I know. Just like the doctor. Am I right?
Jugger went missing for a short time and contracted this respiratory infection due to the stress and cold. After treatment, Carlos may want to force-feed him killed prey if he still doesn't want to eat. Giving him live prey at this point may lead to unpleasant repercussions for Jugger.
How do you force feed a snake? Kisses. Vomiting and difficulty urinating.
Hi, I have a question.
Make it fast.
What does it mean when a cat won't pee, licks himself down there, and then throws up?
It means you should bring your pet into the vet.
Well, then I must be pretty smart.
That's one way to look at it. Doctor, what do you think it means?
That's one way to look at it.
I have a question. Do you like to cuddle cats too?
What's with these people and cuddling? Relax. Look at your butt. Rear.
Blood and urine don't mix. Scared sick, maybe. Blood is flowing okay, but those gums. That's quite enlarged.
Seems like more stones.
Well, I'm smart, so I can tell that you're smart too.
The plot thickens. It's not much, but it's a start. He won't want to be awake for this. Nobody said this job was easy.
I have hugs and I have kisses, and they like each other too.
Definitely something up with the urinary tract.
Oh, that's his other pet's name. Hugs and kisses. That's so funny.
The pieces are coming together.
Are they? Oh, I forgot to ask questions. You pet him, do you feel anything strange?
Nope.
Nope. His kisses have been behaving abnormally.
He licks himself more than usual, and he has some trouble, when he urinates, but oh, and he throws up too.
Have you seen anything else out of the ordinary?
I saw some red when he went to urinate.
Glad nothing has reached his heart. No bladder stones either.
X-ray is normal. Alright, so what do you have? A UTI.
I have a question.
Why am I not surprised?
I don't know. My question is, do you think cuddling kisses will minimize stress?
You know what, Bill? I think it just might.
Kisses has a case of feline lower urinary tract disease. Straining to urinate, licking on the genitalia, urinating in unusual locations, and bloody urine are all symptoms of this disease. Being a male cat, Kisses was also susceptible to urinary blockage, and he could have died in a matter of days. You ruled out bladder stones and tumors as the cause of his condition, so he might have contracted it due to an infection in the urinary tract or some sort of trauma to his bladder. Bill will need to increase Kiss's water consumption, minimize any stress, and keep him on a special diet in order to keep him as healthy as possible.
Dexter the bullfrog.
Well, look at this pretty little thing.
Pretty? He looks like he has blisters on his skin.
I was talking about... Never mind. All business, I get it. Ever since Dexter's got that skin thing, he barely eats and he's been bumming around more than usual. Even my dates have noticed.
We can't have that.
Jealous?
No, it just looks so painful for him. Doctor, let's help him out as fast as we can.
This dude.
Some people just don't dig the frog.
A sick pony has arrived. A pony? Alright, hold your frog, mister.
We love Amiga so much. My little girl, she's 10, rides her as much as she can.
Horse girl.
That's why we wanted a pony in the first place. For her.
What's wrong with Amiga?
She's not eating. I think there's something wrong with her teeth. Seriously, is there anything you can do? I'm sorry I'm so anxious. I mean, it's just my daughter's so worried.
Then your daughter can relax. You've got a great vet.
Owning a horse is a serious responsibility, but I don't mind.
Okay, horse girl, horse fam. You are 450 pounds. Miss Amiga, you're not eating.
Her ribs are catching my attention, and they shouldn't.
Okay.
That's some swelling.
Right side of the mandible is swollen. A tooth root abscess. Uh-oh, horse dentist.
Feels kind of warm.
degrees, normal.
I told my daughter not to worry, and now I can tell I was right.
Use the scale to weigh the animal. What kind of scale do we have that's big enough for a freaking horse?
She is running very thin.
Weight is normal.
You can feel every rib.
Some horses and other animals have a heavy hair coat. It is always necessary to feel the horse's rib area to see how thin the horse is. A heavy hair coat can make the horse look fatter than he really is.
Amiga likes carrots, so I always make sure to bring her some.
Doesn't seem like an internal problem.
Here's some medicine to your neck.
Now we can get to work.
An injectable sedative is given in order to perform a complete oral examination. A horse needs to be sedated so that we can place a dental speculum in the mouth and look at all the teeth. The sedative also provides some pain relief. Okay, we're gonna look on your mouth. What am I looking at? What is this? This is the mouth?
What can you see?
Jesus Christ. The dental speculum allows a veterinarian to look inside the mouth at all the teeth and also reach into the mouth and feel all the teeth without getting bitten by the horse. What's the magnifying glass?
Is that pus?
The first cheek tooth on the lower right side has some pus around the base. This one? Ew. That's disgusting. Use a glove.
Feels like she's going to lose a tooth.
A tooth that is loose in an older horse should be removed because it causes discomfort and may become infected.
I know I'd prefer it to be less painful.
Pulling your teeth out.
Perhaps there was a better way to go about that.
I take Amiga out for her morning runs. Just to warm her up, of course.
Time to play the tooth fairy.
Ugh. Loose teeth in an older horse have short roots and can be pulled fairly easily with a molar extractor. Infected teeth in younger horses may require additional instruments for extraction. Let's clean you up.
She won't want this in her mouth. Try again. Maybe you'll fail again, but at least you'll fail better. The less blood, the better.
Stop.
Martin will need to do this for a week.
She hasn't been eating.
What size shoe does Amiga wear?
She's massively thin. It's not cool.
It's not cool.
I don't know enough about any of that. I'm so glad. I mean, my daughter will be glad to know that Amiga is fine.
And you can tell her father that Amiga will be around for quite a while. Won't you, mi amiga?
Pulling Amiga's tooth will help stop the pain of the root abscess. Flushing the area thoroughly prevents the abscess from returning. Amiga should be able to eat hay normally. A vet may need to grind down the opposite tooth so that it doesn't get too long. If she loses too many teeth, we'll have to explore feed options other than hay.
Horse girly. Pony girl. Alright, back to this frog.
Ouch!
Tumors.
Don't want to press too hard.
You got a sunburn?
No one wants to damage his skin even more. This will soothe his skin. Hopefully those blisters will die down soon.
Blisters must feel a bit different, but I figured it would hurt him to touch. Took him out on the patio with a date for a few hours. Ever since, seems like the life's been sucked out of him. Of course, he hasn't been eating either. There's blisters on his back.
You got a sunburn, buddy.
That's the last time I leave Dexter in the sun. Now I'll just have to entertain my ladies indoors. So, did Antonio tell you about me?
Why would she?
Well, I just thought maybe... Oh, hey, Doc. Save me again. Thanks. I mean it.
Sunburn hurts, no
up,
matter who
dude.
experiences it. Although in the case of Dexter, the results were quite severe. Dexter will need to stay out of the sun for a while to allow the blisters to heal.
Hit by car. I'll treat you last.
Time for a regular checkup?
Wish I could say so, but I wouldn't have any sense if I thought all was well and good. Take a look at her leg.
Take a look at her leg.
She's holding up her hind leg, but no sign of abrasion. Okay, we'll get right to...
Wait one darn tootin' minute. I'm telling you to take extra care of Liza May. I got a lot of dogs, but she's the sweetest. Just take care of her. Please?
Put your hands emoji. Wait just a darn
Don't you
minute.
let my Liza May down.
Oh my god, you look not
Liza
good.
May won't eat unless I'm sitting right next to her.
Your eyes are bugging. What am I looking at?
I don't like hearing noises from a dog's knee.
Aren't you old? An old lady. Normal.
You're better than pizza for breakfast.
Pizza for breakfast? You crazy. This is normal.
I like taking Liza May for a ride in my pickup truck. I reckon she likes it too.
The fracture doesn't surprise me, but that lesion sure does.
That's not even the right... This is a forelimb, I think. That's not even the right arm. Fractured femur bone. Bone lesion is present.
You certainly got my attention with your fancy vet work. Now, she didn't like it when I touched her leg. Now, ever since Liza May ran into a table leg at top speed, she's been favoring that leg like there's no tomorrow. Walking around with her leg in the air all the time certainly caught my attention.
That's clear, at least.
I like to go out into the woods with Liza May.
Now she'll stop trying to bite, I hope. She's ready for the main event.
Wait, what was it? A bone tumor? I was not paying attention. I'm speed running this case. No evidence of cancer spread. Bone tumor.
Did we take care of Liza May to your satisfaction?
Did you? And then some. Didn't mean to rile you before, but...
You care about Liza May. I can't fault you for that.
I appreciate it. And I appreciate you, Doctor. Thanks for everything.
As if being painful weren't enough, bone tumors also spread aggressively. A vet must consider treating both the pain and the spread of the cancer. Because of the serious nature of this cancer, amputation with chemotherapy may be your only choice in staving off death.
Staving off death.
Here I am again. This time it's Hannah's cousin Lana, who poked her nose somewhere it didn't belong and has a cut to show for it.
I hope this just happened because she's still bleeding a lot.
Oh yeah, it was like an hour ago or so. For you, this must be another day, another dog problem.
Oh no, it's never routine at this office. Besides, our patients are always number one in our hearts. Right, doctor?
Sure, it's just a cut, but maybe there's something more you could do.
I can't believe that cut is still bleeding. That cut must really hurt. She's okay here. Nothing too serious here. And still she bleeds. What is going on? Does this tell us anything? Oh, now I get it.
Poor clotting factor. Buccal bleeding time is a measure of blood clotting cell function. Blood should clot in less than 4 minutes. Von Willebrand's factor is a blood clotting factor carried by platelets and also present in blood vessel lining. You need more blood. Go get it.
Sometimes the body needs a little help.
Fresh frozen plasma slowly transfused. Lip bleeding stops. This patient needs more von Willebrand's factor in order to stop the bleeding.
You're a natural.
I like to mop up any mess.
Hannah wanted to come too, but I figured you'd have your hands full.
All better now.
Wound repaired. Have you considered not throwing away your bottles?
All I know is I've never bled for a solid hour. Sticking her nose in the garbage, normal. Bleeding for an hour after cutting herself on glass doesn't seem right. No. Keep Hannah away from the beach, keep Lana away from sharp glass. How did I get so lucky to have such crazy dogs?
So the disease doesn't scare you?
Not at all. Lana will still be herself, and if anything happens, I know I've got the best vet just a phone call away.
We'd like to blame Lana's bleeding on an infection, but we'd be ignoring this common blood clotting disorder called von Willebrand disease. She probably inherited it from her parents, although Maria shouldn't be surprised only to discover the disease now. Oftentimes, the disease will come to our attention only through a cut like this. Maria will have to keep a close eye on Lana in case she gets cut again. But if she does, I'm sure you will be ready to handle it.
All right, hit by car dog. Let's go.
Oh, man! You've got to do something!
Looks like he's been hit by a truck.
He was. He was hit out on the street. Oh, man!
Okay, no time for jokes. Let's get to it, Doctor.
No time for
Doc,
jokes.
please, Bernie needs the best you can give.
How old are you, Bernie? 3 years?
We've got some blue in the membranes, blue in the gums. And those will heal on their own. If I just got hit by a car, my heart would be racing too. Oh, sticky gums. No time to wait on this. We got a respiratory problem.
High respirate.
Those sounds are giving me chills. He's had enough shock for one day.
Low tempi.
Let's hope this doesn't mean another problem. Broken bones and air near the lungs.
Air in the chest cavity is called
Guy who hit Bernie
pneumothorax.
couldn't apologize enough.
Respiratory distress can be alleviated by tapping the air off the chest with a needle. Use the pulse ox in the animal's ears.
Well, hopefully those fluids we put in will bring that reading up. Maybe he just ate some sugar. I can hope, can't I?
What kind of shaving job is this?
Okay. Ready. I'll bet that's a relief.
Air tap from chest. Respiration eases, mucous membranes become pink. Tapping the chest removes air that is trapped in the chest cavity, easing respiratory difficulty.
Well, we don't want to add infection to his list of ailments. Sealed up for healing. And the other. There, now he can walk easy.
I don't know. How are you supposed to act after you're hit by a car? I felt the scratches on him, and maybe his chest seems a little weird. He's got all these scratches. Man, I wish I could have saved him. Man, I can't believe that.
I can imagine. Seeing your dog hit is not something I want to see anytime soon.
Tell me about it. But that's not what got me. I came in here a wreck, and you took charge. Before I knew it, you saved him. I never knew someone could work so hard. Thank you. From Bernie and from me.
Bernie was not only hit by a truck, but also by a shock to the respiratory and circulatory systems. If untreated, shock may have permanently affected his health. You were able to tap the air off his chest, alleviating his respiratory distress. If the air leak continues, however, you may need to use a chest tube.
That sounds awful.
You've done it. You've dealt admirably with each and every case. You've braved the best and the worst. What can I tell you? Your performance here has surpassed all our expectations.
I expected a big party. Oh, wait, this is it. Well, I also expected dancing bears. Hey, it was worth a shot. You did a great job. For real.
You've already gotten all the awards we have. So we made up a new one just for you. the Ace Veterinarian Award.
I knew you'd do well.
You really showed me a thing or two. If you ever need an extra hand with a patient, you know who to call.
You've helped save and improve the lives of many fine animals. Congratulations, Ace Vet.
Heck yeah. Ace Vet is right. You've completed all the cases and helped all the pets. Why not try again at a higher level of difficulty? Don't forget to look for your special award if you received a perfect score on all your cases. I did not do that. I did not... I sadly did not 100% this game. That's okay. I want to care for a guinea pig. Here you go. I'm not actually sure if you're supposed to be washing. Ace Vet, Ace Vet. Alright, let's brush all the suds away. I want the 100% achievement award, whatever you get from that.
Hi, Doc. Remember Anna, the turtle with no mojo? Well, Anna is on fire now. She actually moved faster than a snail today. Thanks again for your help. By the way, did Antonia mention me at all?
Hi there, it's Alex with the upside down fish. It's all clear now. I put Nico back with the other fish now that he's swimming pretty. I'll tell all my friends to take their fish to you. Hello, this is Patricia with a follow-up on my guinea pig, the one with adrenal gland disorder. Since the surgery, Cody has been growing more fur every day, and if I'd been in charge, well, let's not think about it. You certainly are a real doctor.
Hello, Doctor. I'm supposed to call you back about my cat Hugs. She doesn't look so thin or overweight now. But I have a question. Can someone call me when I should bring her in again?
This is Mark calling about Patty, who got sick after eating lilies. Patty is purring in my lap as we speak. Glad I still have time with her. Patty sometimes looks for something to play with, but I make sure there are no lilies in sight. Thanks again.
Hello? Carrie calling about my cat who got shocked by an electrical cord. Jonah's running around the house crazed as normal, and I couldn't be happier about it. Thank you.
This is Alicia. How wonderful to have met you, Doctor. Ever since the hairball incident, my rabbits and I have grown closer because we drink pineapple juice together. Your spirit is truly beautiful. Thank you. Hi, Doctor. I'm the owner of Astro, the dog who ate too much. He's no longer got a bloat problem, and I intend to keep it that way. I'm not going to let him anywhere near people food, boy, if I can help it. Hi, Doctor. It's Kelly. Well, the bladder stones are gone. I've been feeding Rhett exactly like you said, and he's been having a grand old time. I owe you a debt of gratitude for everything you've done.
Hi, it's Carrie calling. My bird Molly has been chirping up a storm ever since she got back from surgery. She's been driving my cats crazy, but that's normal. Thanks for keeping the family together.
It's Lila again. Oh, I have to tell you how wonderful Rose has been since that scaly face went away. I've told all my friends about you, and you may have saved a bunch of other birds as well. Thanks again.
That was nice. I actually do like that they included that in the game. All these cases, 2, 4, 6, 8, 10, 12, 14, 16, 18, 20, 22, 24, 26, 28, 30, 32, 34, 35 cases. Amiga and amigo. Alright, we're missing 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13 trophies. Possibly 14 trophies. That's fine. That is a-okay. Is there anything? Oh look, Certificate of Excellence. Ace Veterinarian Award. Nice. What is this? Animal Welfare Award. The Veterinary Technicians Award. Cool. Oh my god. No, return to waiting room. Save. Alright, we cured all the animals. There are no more sick or injured animals. We did it all. Alright, that is it for today's stream. Thanks so much for coming and hanging out and lurking and chatting and what have you and stopping by. Excuse me. I will see you all next week. I don't know what I'll be doing, but it will be something. Have a good day, everybody. Goodbye. Thank you for joining me on this veterinarian stream.